Thank you very much for taking time out of your busy lives to join us tonight on an important conversation about the future in our community. My name is Mike Summers. I am the mayor of Lakewood, and in my capacity as mayor, I serve as a trustee, one of 23, on the Lakewood Hospital Association board. And this is a great privilege for me because I always wanted to be on the main stage in the Mackey Theater. Unfortunately, this is as close as I'm going to get to any talented demonstration here. Joining me today are Dr. Brian Donnelly, Chief of Staff and previously head of the regional hospital system. Brian's the second one in. Brian, if you just raise your hand. We have Tom Gable, who is Chairman of the Lakewood Hospital Trustees Association. Ken Haber, also a trustee of the association and president of the Lakewood Hospital Foundation. And we have Lisa Fry, principal of Subsidium Healthcare, who has been our independent advisor to the trustees on strategic options. I would also like to ask members of the hospital board of trustees who are here, and I know several of you in the audience, if you would kindly stand. If we got to take heat, you guys have to take heat. So it's 23 members, several are here tonight, so you might note that if you have questions afterwards that they would be resources as well. I'd like to acknowledge some elected officials who are also with us tonight. I noted that Mike Skindell, Senator Skindell, I saw you come in, Mike. Where are you? There you are. Yeah, thanks for being here, Mike. Traveling up from Columbus, I'm sure you're in session. Mike's a former city council member and a long informed member of the issues of Lakewood Hospital, so we're pleased you could be here. We also have Councilwoman at Large Cindy Marks. Cindy, where are you? Cindy in the front row. We have Tom Bullock, also Councilman at Large. Tom in the front row as well. Mary Louise Madigan, Council President, also here with us. And I noted Emma Petrie Barcelona, School Board member. And Terry Allen, who is the Board of Health Commissioner and Director. Terry, I think you're in the audience here somewhere. Yeah, thanks for joining us as well. That's the County Board of Health, who's an important part of helping us on the public health side, an important element of our resources here. Have I missed any elected officials who have come in that we didn't quite? Sean Juris, Councilman Ward 3, Sean Juris. Thanks, Sean. These folks also are a big part of the conversation that's beginning, and they're here to learn and also to help you understand as well. So our objective tonight is to present details regarding the changing from the current inpatient model to the outpatient model. We're here to talk about the process we employed over really almost 2 years formally, about a half a year before that informally, to determine what are the strategic options before Lakewood Hospital and which ones make sense. We're here to clarify the proposed plans that were announced through a non-binding letter of intent. And we're here to explain from the trustees' perspective and the clinic's perspective why we think this makes sense for the city and the community, really, going forward. And finally, we want to provide an opportunity for you to ask questions and make comments. So we're going to move through a lot of content in order to create time to allow us to benefit from your interest. Now, as probably many of you know, in Lakewood, we think a lot in many ways and in many instances about our second century. Lakewood became a city in about 1911. Before that it was a village, and before that it was a hamlet. And many of the institutions that have served this community so well were built in the 1920s and the 1930s. And we know from our experience in looking at how education is performed in the past and how it needs to be performed in the future that investing in new institutions of education are an important part of the viability of our community long term. And we know that's true of our 100-year-old housing. In fact, 50% of the houses in Lakewood were built prior to 1920. And the other 50%, by and large, were built by 1939. So we know we have a unique community, but one of the things that makes it unique is that we've had a built-up community designed in a trolley car era that is approaching the end of its first century in so many ways. And there's a lot to celebrate there, but there's also a lot to invest in to make sure that it meets the needs of the second century. And we're here today to talk about a healthcare delivery system that we think addresses the dramatic and rapid change of healthcare delivery and how we can make sure that healthcare and its success in delivering a healthier community is a big part of our future. I think it would be important for me to spend a moment or two to talk about the unique history of Lakewood Hospital. It was started in 1907 as a privately owned hospital by some very enterprising physicians. It was acquired by the city government and became a public hospital in 1931. And it was done so to rescue it from the forces of the Depression, which were threatening its viability and survivability, and also to make sure that the community health was appropriately addressed. And in those days, tuberculosis, scarlet fever, pneumonia, and rheumatic fever were among the major public health threats. In 1985, the voters of Lakewood agreed to shift responsibility of the management and ownership of the hospital, that's the operating side, back to a private nonprofit. And it's important for us to understand that point. And the community understood in 1985 that the forces affecting healthcare delivery were sensitive, they were dramatic in 1985, mind you, nothing compared to what we think we're seeing today, and that the sensitivity of patient care and employee relationships were not as well served in a public context. And the voters overwhelmingly affirmed that decision. So from 1985 to this moment, the hospital is managed by a private, nonprofit entity called the Lakewood Hospital Association. And that association is governed by a board of trustees, 23 strong, that oversee its operations. That board of trustees, in return, in 1996, signed an agreement with the Cleveland Clinic to actually operate the clinical portion of the hospital. The city of Lakewood remains the landlord. So we own the physical asset, and we rent it to the hospital association, who then has an agreement with the clinic to deliver health care to our citizens. And I would think it's fair to say there's probably few hospitals in our region that have this complex of an ownership. And it got there for good reasons, and I think one of the questions we have among the trustees was based on decisions made 25 and 30 years ago, what would be appropriate for both ownership of the clinical delivery and how that decision is made going forward. And so that's an important backdrop, I think, for you to understand of how and who makes decisions on behalf of the hospital and its future. Now, City Council has an important role. They are the ones who are the only ones in the city of Lakewood that can grant authority to enter a contract or change a contract. So City Council's role is revving up. They are looking at the specter of a new definitive agreement that will require a decision on their part to probably leave the current definitive agreement and then enter in a new one if this, in fact, idea has legs. So there's a lot of pieces and parts going ahead and are in front of us. We're here at the very beginning. What the letter of intent does, and all it does, is put the shell of the big ideas that generally came to agreement. What's still before us are discussions of all the details of how to deliver these big ideas. So it's an important point that we're here really at the beginning. And any discussion prior to this, we feel would have been very confusing, because you're going to learn about a variety of options that were considered, and you're going to learn about a variety of confidential conversations and negotiations that might not have ended as they did, or would have ended in a different place had they not had the sensitivity and confidentiality of other private corporations and how they think and behave. And I know that's a sensitive issue for us to understand, and I think as we move forward in our discussion of this particular subject, we need to spend some time on that, both tonight and other nights, to make sure we understand more carefully this complexity. So on January 14th, at about 9 p.m., the 23 trustees of the Lakewood Hospital Association voted to recommend adoption of the letter of intent that has been the subject of discussion here, and they did so unanimously. And prior to that, the trustees of the Lakewood Hospital Foundation also considered its merits and cast a unanimous vote as well, that this was the best path forward. Throughout the process, the primary goal has been to provide for the evolving healthcare needs of the citizens of Lakewood and our surrounding communities, while advancing the economic revitalization occurring in our Lakewood business district. Unlike 1931, the community health needs of today are radically different, and they are primarily driven by lifestyle and habits that are determining less than good health outcomes. And we think of these as chronic conditions such as diabetes, high blood pressure, hypertension, tobacco, drug, and alcohol dependence, and mental health. And none of those types of solutions to those types of issues would you today serve lying in a bed. But they are situations that need very careful healthcare coverage, both clinical and social. And part of our opportunity in Lakewood is to create a community-wide approach, including all the elements that would drive success towards those. We need to do it for the sake of the individuals and their patients and their quality of life. And I would say this is a national conversation driven by many of the cost drivers that have fundamentally led us to conclude that we can't afford the kind of health care that allowed people to get profoundly sick. We would put them in a bed, try and fix them, and the costs that would go with that. There has to be a better model driven by prevention, early detection, and better health behaviors. So the proposed plan you're going to hear tonight will explain the $120 million investment in a new way to deliver health care in the community of Lakewood. We understood that it had to be financially sustainable over the long term, and it had to meet the needs of our citizens as we grew to understand them today. I will tell you from my experience talking about this, really intensely for the last 2 weeks particularly, but really thinking and talking to others about it for the past year or two, this is a very complex subject. None of us get this in its complexity the first time we hear it. It's important that we take the time to hear it tonight. Some of you have heard pieces and parts of it before. That's helpful. I think the more you hear it, you'll understand it better. Whether you agree or disagree with it is an important ultimate point, but the key is to understand it in its true intensity, and there's a lot of parts. So our goal today is to present this complex story in as clear a way. So here's what we're going to do. Tom Gable is about to tell us a little bit about the trustees' call for action in 2012. Lisa Fry from Subsidium will share the strategic assignment that Subsidium was given and the resulting analysis and recommendations that came from that assignment. Tom Gable will again return and talk about the elements of the letter of intent, so make sure we understand that. And Dr. Donnelly will talk about the clinic's view of the clinical portion and their role there and their vision. I will spend a few moments talking about the financial impact of the city of Lakewood. Then Ken Haber will share his view of, are you there? He'll share his view from both as a trustee and as a member of the Lakewood Hospital Foundation. With that in mind, let's go ahead and get going. Tom?
Thank you. Thank you, Mayor Summers. Hope everyone can hear me. My gosh, thank you so much for coming out on this cold, cold night. We appreciate it. It shows a lot of dedication and community interest, and I think that's important. That's something we've had in Lakewood for many, many years. As Mike mentioned, the history of Lakewood Hospital is well over 100 years, and it's evolved to what it is today because of the effort of quality caregivers and physicians day in and day out, and that process continues today. We need to remember going forward that every day during this transition period, which could take close to 2 years, that quality and safe health care will be delivered on our campus, and we continue to monitor that and provide that through the management with the Cleveland Clinic Health System. The status, as Mike mentioned, changed in 1985 with voter approval and transferred to a Lakewood Hospital Association Board of Trustees. 23 members from virtually all walks of life, some Lakewood citizens, some citizens of nearby communities. In the past, over the years that I've been on the board since 2000, so now coming up on 15 years, we've had mayors from a number of the surrounding communities, including Rocky River and Bay Village and Fairview Park. We've had wonderful participation from our elected officials. We have 3 representatives from the city all the time on the Board of Trustees, the mayor and 2 council persons, and they rotate based on their terms of office. There are 2 additional board members that came in tonight since Mayor's introduction, Joe Gibbons and Rebecca Patton, I believe. So I'm happy to have you here tonight as well. The process began about 2.5 years ago, as we've already stated, when, as board members, we saw from quarter to quarter, and that's when we meet every 3 months, the change in the way healthcare was being provided, the decline in volume of procedures, the decline in reimbursement, the extensive care that had to be given without insurance company, Medicaid or Medicare availability of payment. And it came to us as our fiduciary responsibility. Should we just sit by quarter after quarter and listen to the reports of management and then go on and wait till the next quarter? And that was a resounding no. I mean, we should be proactive, not reactive. And the responsible members of this board, and again, we have nurses, physicians, businessmen, accountants, attorneys, people from all walks of life, said, we as a group can't just stand idly by and watch this continue to deteriorate. And I say deteriorate, that doesn't have anything to do with the level of care. That was quality care and it was safe care. But there was less of it and less volume, and it didn't seem to be that we were growing or improving or going in the right direction. There were a number of initiatives undertaken under the guidance of the board and the Cleveland Clinic Healthcare System Management Team to pump up the business and volume and revenue, so to speak, as best they could. But at the end of the day, the things didn't change very much. And as you've probably heard in the press, from 2005 on, there were things that were less than acceptable, and we felt action had to be taken.
Wasn't that because of the clinic's decisions?
We're going to allow for questions and comments, and if you'd be so kind to let us explain this complex story, and then we'll be glad to hear from you.
Right, thank you. We'll work through the presentation first. So the board recognized as a group, collectively, a lot of expertise, yes, a lot of very well-meaning, dedicated volunteer board members. However, we're not healthcare professionals per se, each and every one of us, even though we had physicians on the board. Could we make a strategic plan and put something in place that would be of quality, that would be sustainable, and would address the future needs of the healthcare delivery system for Lakewood and the nearby communities? So we put out a proposal, and we requested national healthcare consultants to fill out their proposal and come back to us and tell us why we should hire them to analyze and assist us in determining the future of healthcare in this community. And we went out to every national healthcare provider really across the country, some large, some small. At the end of the day, it came down to 2 or 3, and the committee selected Subsidium Healthcare from Atlanta, Georgia, and Lisa Fry, their representatives here tonight, and you're going to hear from Lisa a lot of the things that the studies they conducted, the data they put together, the analysis that they provided us. After we received an awful lot of that analysis and studies were completed, we continued to meet, and a lot more frequently than quarterly, with caucus groups and Step 2 team groups, and we were able then to narrow down, well, what other choices do we have besides the current model? And at one time there were as many as 10, and you'll hear about that, I think, more in Lisa's presentation. But the fact of the matter was, we came down to 3, and then 2, and then 1 to move forward with a more modern, more innovative, more technologically advanced transition to outpatient services, to population health management, which is a term you'll learn a lot more about as time goes on. And we thoughtfully considered different providers, actually different providers other than the Cleveland Clinic Health System. We sought proposals from national healthcare hospital chains, for-profit and not-for-profit, and we considered all of those alternatives too. Would there be an opportunity for a different partner, and someone that had experience, and someone that could deliver the quality, forward-thinking healthcare that we've now been enlightened to via the Subsidium Healthcare team's analysis and their investigation. We had their conclusions and ultimately their recommendation. So the best partner happened to be the one here in town, one we already have a definitive agreement with, but it would have to be modified, or it would have to be terminated and a new definitive agreement created. And therefore, we entered into a period of negotiations with the Cleveland Clinic and the Lakewood Hospital Association and the Lakewood Hospital Foundation to determine a letter of intent to say, well, if these are our guidelines, this is how we'll proceed, but there's certain things we want to be able to take away and provide for the community for many, many years to come. This is healthcare in a crystal ball, 50 years from now, because of what we're going to do in 2015, 2016, preparing for 2017, that we have the quality, innovation, the technology to provide the best possible health care and start reaching the goal of making Lakewood one of the healthiest communities in the country. There are so many opportunities. The potential's enormous. So once that letter of intent was signed, we made things public, and that's when we were legally able to do so with our partners. And we've welcomed the next steps. We welcome your input. We welcome the community input. And we will be gathering that on an ongoing basis to help us determine where we'll go from here, not necessarily just in the healthcare delivery system, but in the terms of the new, I'll call it Lakewood Health Foundation, that will be born out of this process, and we'll continue to do that. I think now I'll introduce Lisa, and she'll come up and give you a little bit of history of how their process worked, and then I, again, look forward to questions and answers later this evening. Thank you. Thank you, Lisa.
Thanks, Tom. I will, thank you. Whoops, I'm going backwards. Did we? Well, good evening. It's my pleasure to join you all tonight and have the opportunity to tell you about some of the work we've done. I'm Lisa Fry. I'm a partner with Subsidium Healthcare, and as Tom and the mayor mentioned, we are based in Atlanta, Georgia. Although I'm a Michigan girl by native. In July of 2013, as Tom mentioned, we were engaged by the Lakewood Hospital Association Board of Trustees to support them in thinking through and evaluating various strategic options and to really think about what the future of healthcare in Lakewood could look like going forward. And as Tom just described to you, what we found very quickly is that Lakewood is facing many of the same challenges that hundreds and perhaps even thousands of community-based hospitals across the United States are facing. So you'll see a list here, and you know, obviously the check marks kind of show these are both national trends, but also many aspects of which are also present here in Lakewood. So we have challenges with Medicare reimbursement. The Medicare reimbursement rates continue to decrease. The government is under obviously a great deal of pressure from a spending perspective as well. And for most community hospitals, roughly half of their revenue comes from Medicare. So if that half goes down, something else has to happen in order to continue to focus on profitable performance for hospitals across this country. And so that's definitely a trend and a challenge we see here as well in Lakewood. One of the most important trends that we looked at and that we're going to talk some more about as I go forward here in some of my slides tonight is this trend, and you've probably heard a lot about it already, even in some of the news, this trend away from inpatient care and toward outpatient care, ambulatory care. With evolving technology in healthcare in general, and Dr. Donnelly is going to speak to that much more eloquently and clinically, I'm sure, than I can. But we see tremendous trends toward that, and we see that in Lakewood as well. Here at Lakewood Hospital, approximately 94% last year of the visits and the encounters with patients at the hospital were outpatient focused. Only 6% of them were inpatient focused. So clearly something that's reflective here as well. And then I'm going to talk a little bit more in detail about some of these. So we quickly concluded, obviously, as we started to really dig into what was going on here in Lakewood, that there were definitely some common themes and issues that we'd seen with some of our clients across the country. So in particular, though, as the mayor mentioned, Lakewood is in a very unique situation in that you still, technically, at the end of the day, the hospital and its assets are owned by the city. And that is a fairly increasingly rare breed, if you will, in this country. So back in 2006, there were still about 1,120 hospitals that were owned by state and local governments. And over the last 7 years, that has declined 10%, and it's down to just a little over 1,000 of those hospitals now. So clearly there are communities across this country who are sitting, in seats similar to yours, thinking about whether or not the healthcare business is too difficult and too challenging to be in for cities and governments and state governments that have many other significant challenges to face as well. In the alternating or sort of alternative spectrum, what we also see quite a prevalent trend around is that community hospitals across this country are increasingly joining systems and deciding that going it alone is not really a good strategy going forward. And so we took that trend into account when we looked at what the status quo would mean for us late in 2026, when that lease expires with the clinic under its current format. We needed to think about where would we be left at the end of that future, and obviously what we potentially would be left as an independent hospital, which again is not necessarily a place that that many hospitals across the country are choosing to be. And so I mentioned this already, but we've talked a little bit, and we talked a lot throughout the process of the time that we spent with the Lakewood board, really focusing on this trend toward outpatient services. So if you go back to the early 90s and you think about the types of things people were hospitalized for and how long they stayed in the hospital, not even 25%, not even a fourth of a typical hospital's business was outpatient services. But you fast forward to today, and nearly 40% of those revenues are coming from outpatient services. And in just literally the next 5 years, we expect that it will be nearly half. The acceleration rate is increasing over time. So it's a really important thing to consider as we thought, what type of, from a sustainability perspective, what type of facility and what kind of healthcare services here in Lakewood would make sense and carry you into the next 2 or 3 decades. So then what we did essentially is we went through a rigorous process, and I think both the mayor and Tom mentioned, we personally here, even with Subsidium, have been involved here in Lakewood for about 18 months and really supporting the board and thinking about how to go through this evaluation process and think about what the future of healthcare should look like here in Lakewood. And it really broke down into 4 steps. Now, it's not quite as perfectly linear as it looks here on this slide, but we'll talk about that as we go through this a little bit. But first, we thought about the context, and we've already talked some about that tonight. And that was really all about, do we truly believe the status quo is tenable for the future? Is it sustainable, or do we really need to look at some other options? Second, if we do get to that point where we conclude that perhaps the status quo is not a tenable situation, then we needed to think about, well, what else were our options? What else could we do? And we looked at some of those from a strategy perspective. And so at the end of that 6 period, we thought about, we made a preliminary decision about a direction and we'll talk about that, but that was generally outpatient in nature. And then we needed to think about who would be the best partner to go down that road with, to go down that path with. So we thought about that. And this is a place where it's really important. The board took its time and circled back to the options. So despite the fact that we thought from a conceptual standpoint, an outpatient facility might be the way to go, we still did a lot of work turning over a lot of stones in terms of whether we could find anybody across this country, any company that would be interested in partnering with Lakewood Hospital and keeping it a hospital. So we're going to talk about that some as well. And then lastly, once we had made a choice about the partner that was best for Lakewood going forward, we had to decide under what circumstances and terms would that be a sustainable arrangement for the community, the city, the foundation, and for the clinic as well. So all the parties involved. So this is sort of how it went. Now, like I said, it wasn't quite as perfectly linear as this, but those were the major steps that we went through in the process. So just from a context perspective, we talked about the national perspective, and from a local perspective, it was very similar. So what we were seeing in what we would call the primary service area for Lakewood Hospital, and that's the 4 zip codes, that's 44107 and the 3 surrounding zip codes nearby Lakewood, the trend in inpatient admissions over time, over the last 5 or 6 years. And you can see it's definitely downward, and that's very consistent with what's going on across the country. But you can see then when we look at Lakewood Hospital specific admissions on this right-hand side, it's very similar pattern, perhaps a little more pronounced than the market overall, but actually not that much different, very, very similar in terms of the pattern. And as Tom mentioned earlier, we had the resulting impact of that, which was the impact on the financial performance of the hospital. So what we looked at as a consultant from that perspective is, ultimately, is the hospital expected to generate enough cash and enough financial performance that it can fund the investment it needs to make in its own future? So obviously there are maintenance costs, there's always new equipment coming online in terms of healthcare, it's expensive. And so the hospital performance from a financial perspective needed to be able to sustain that growth. And what we were seeing in some of these operating losses year over year was that the hospital was struggling to be able to do that. So that was the context, and so what we agreed based on that is, and obviously you heard a lot about that, the decision was we need to think about some other options. What would it look like if it wasn't, status quo? And so we actually looked initially at 10 options, and we put them through a preliminary screening process. And we looked at them from the lens of market trends, the competitive environment, which is very competitive here in the Cleveland market, what type of medical staff and clinical staff we had on the team already in terms of how that would fit with the different options, and what would have to happen to the facility itself. Could it be repurposed, let's say, for example, to be a specialty hospital or something like that, or would there be costs involved in retrofitting that facility? So we did that analysis, and I'm going to skip ahead and then come back to these slides here. And so there were 10 options that we looked at initially with the board's blessing. And that ranged everything from, just to be complete, getting out of healthcare. Let's just get out. This is too complicated. Let's transition out. And then down a spectrum toward the status quo. So we looked at a comprehensive outpatient campus, an outpatient focused campus, but that had some inpatient beds still attached to it, perhaps rehab beds of that nature. We looked at multiple options for converting the hospital to more of a single specialty type of facility. So we thought about, what if it's just focused on orthopedics? It's already a current specialty of the hospital. What if it's focused on rehabilitation services? What about behavioral health and psychiatric services? And what about long-term care? Either long-term acute care, which is typically long hospital stays of more than 30 days, folks who need ventilator care, et cetera, or skilled nursing facility care. So more, similar to what you might see in a nursing home type of environment. We looked at downsizing the hospital. Well, maybe it's just too big. We could keep it generally focused the way that it is, but maybe just kind of decrease the footprint and make it more efficient from a cost perspective. And we looked at even making it a short stay hospital. So what if we just took not the serious cases, we left somebody else take care of those, but we did the less serious, more sort of day-to-day inpatient stays. So we looked at all that as well, and then obviously weighed that against the status quo. And so I'm going to go backwards here for just a minute. So we put all of those 10 options through that screen, and we said, what's the market telling us about what the implications for each of those strategies would be? And we narrowed it down to 3. And then from there, we put those 3 through another filter, and we thought about what impact it would have on taxes and jobs and the size of the facility and the other economic development opportunities in Lakewood, and we filtered again, and we ultimately came up with our final recommendation, which was focused on creating a comprehensive outpatient care campus or facility here in Lakewood. Now, like I said before, early on, that didn't stop the board from saying, okay, I get that in principle, I understand in concept that that might be the direction we have to go, but we cannot, just rest there. We have to go look, go look at some other opportunities and options and make sure that we're not missing something in terms of potential partners. So while we looked for partners for both the concept we thought might ultimately be the right strategy, which was the outpatient facility, we also went and marketed the hospital to other hospital companies. So we approached all of the large systems here locally in Cleveland on a formal basis, and then we actually issued a request for information or a request for interest to 7 for-profit national hospital companies. And we got some initial preliminary interest from some of those companies, but then when we provided more information and we really started drilling into the financials and the market specifics here of Lakewood, we ended up with no one who was interested in proposing on potentially purchasing the hospital or keeping it a hospital here in town. And so lastly, oops, sorry, I'm gonna go back to my, well, that's okay. So that was the third step in the process. And so where we concluded there at that point was we've got a great partner already. We've got a current world-class, high-quality healthcare partner. People across the country, I think, would find you in an enviable position, given the quality of the care that folks here in Cleveland have access to. And so once we agreed that the Cleveland Clinic was indeed the right partner for us to choose to go forward with, then we needed to think about the terms of those. And so lastly, the fourth step in the process was to, as Tom mentioned, talk about a new letter of intent, to really begin to outline or to frame under what conditions would this be a long-term, financially sustainable situation and condition for both the city, the community, to meet the needs of the health needs of this community, and also that would work for the clinic. And so Tom's going to come back up here now, and he's going to talk with you a little bit about some of the details of that letter of intent.
Many of the things that Lisa talked about, I had one overwhelming goal, and that was to accommodate the healthcare needs of the community as defined in the healthcare needs assessment that was performed for this community. And the federal government mandated that all hospitals and communities perform healthcare needs assessment and submit it to CMS, Medicare, Medicaid, and that was done. And all of the Cleveland Clinic regional hospitals, all the UH hospitals, everybody across the country was involved in the same process. So much of the overview, if you will, was when we looked at all the possible choices, which one of those best satisfied the needs as demonstrated in the community healthcare needs assessment. And the next step was to, as Lisa mentioned, to frame a letter of intent that would be acceptable to these two parties, or three parties in this case, the City of Lakewood, Lakewood Hospital Association, and Cleveland Clinic Health System, with the blessing of the Lakewood Hospital Foundation. And of course, we'll have Ken Haber speak to their involvement and how that process was looked at, and then ultimately what their decision was. Basically, the letter of intent provides that we will be able to retain a significant amount of money that may or may not have been used up to satisfy our losses over the number of years going forward. We'll be able to retain a significant number of those dollars for this new foundation. And so by obligation, at minimum, we'll have two payments of $12.2 million or $24.4 million total by the time the transition is complete. from the combined Lakewood Hospital and Cleveland Clinic Health System sources. And then ongoing, the Cleveland Clinic Health System, owner-operator of this new 62,000 square foot Family Health Center, will make a contribution to that foundation of $500,000 a year for 16 years, another $8 million contribution over that period of time. The continued investigation as to whether or not we will have access to and be able to eventually join forces, so to speak, with the Lakewood Hospital Foundation is yet to be determined. I'll let Ken Haber speak to that later on tonight. But I think you can see at the end of the day, if those resources were available, there's a lot of upside, a lot of potential in innovation, technology, in coordination, in screenings, in just so many different ways that the community could be assisted with a more broad range health focused foundation in place. And it would be unique. It would be unique for us. As Lisa said, I think a lot of people across the country would be envious of our condition and situation that we have the quality primary care community health center to be constructed and have a foundation to focus on health and population health management in our community at the same time. The other main points of the letter of intent are that the clinic will occupy approximately maybe 2.5 acres of the land fronting on Detroit Avenue. The balance of the property is still owned by the city of Lakewood. Part of that is currently occupied with the medical office building at the corner of Bell and Detroit. We have a parking garage. We have the community health center, as it's named, a 3-story structure on Bell Avenue. There are a number of individual residential homes that are still part of the property of the hospital, actually the city of Lakewood at this time as well. So that balance of property will be available for development. And in particular, what we'll continue to enhance. We will still have a lot of private physician involvement with the new community health center and in that medical office building and in the community health center. So that'll be the other component. The building that the Hospital Association owns at 850 Columbia Road is being sold to the clinic, and that was public knowledge at $8.2 million. An appraisal was done through a national real estate appraiser, very experienced in medical office buildings, and that 95,000 square foot building came in appraised at $8 million, and we have an agreement in the letter of intent, as you know, for $8.2 million. Mike, did you want to come up then and introduce Dr. Donnelly? Thank you.
We also, we want to spend a few moments talking about the financial impact to the city, and we'll do that in a minute. But Dr. Donnelly is an orthopedic surgeon by training. He has been a team physician for our sports teams in town. He was in charge of the regional health system, which is all the non-downtown facilities, which are a significant amount of the work of the Cleveland Clinic. And he, effective January 1st, was named Chief of Staff of the entire Cleveland Clinic Foundation worldwide. So he understands and was with us every step of the way, and he is prepared to address the clinic's view of what happens in this 62,000 square foot facility and how it makes sense for us.
Thank you very much, Mayor Summers. I'd like to acknowledge 2 members of my team that are present here today. Dr. Stephen Jones is here as the president for all of our regional operations, and Shannon Ritchie, who is the president of Lakewood Hospital. And they're here also to hear your concerns through this evening. I want to start by acknowledging that the Cleveland Clinic completely recognizes that Lakewood Hospital has been a staple in the Lakewood community for nearly 100 years. It represents many things to many individuals, and I know it provides stability to this community. This opportunity that exists is something to redefine and reinforce that stability here in this community. It's a chance to create a comprehensive, innovative healthcare community model that is sustainable for the long term. As you heard, there's dramatic changes in healthcare and how healthcare is being delivered throughout this country. And there's 2 big drivers behind that. One is the advances in technology in this country and across this world over the years, and the other is the burden of the cost of care that exists in this country. It was estimated in 2014 that there were $3 trillion spent on healthcare in America. That's more than the 10 next countries combined. We spend $3 trillion more than the 10 next countries combined. Last year, it's estimated that $86 billion was treated just on one disease, and that's back pain. And it also is estimated that half of the $86 billion spent on back pain probably is not necessary treatment. For those of you out there, like me, that have had back pain, you know there's nothing better than when you get treatment for your back pain and you start feeling better. But the one thing that's a lot better than treatment is actually to get prevention and to help get to the point where you don't get back pain, where you learn exercises, you maybe learn diet modifications, and then have the opportunity where I wouldn't experience back pain. That's even better than treatment. And it's the same story for many of our chronic diseases. There's great drugs nowadays to treat diabetes, but better than those drugs is learning healthy eating, learning healthy exercise, and not getting diabetes. And so across this country, there's a large focus on prevention. And what used to be really a concentration on sick care and really concentrating just on taking care of patients when they're sick is moving towards a concentration on preventing even the sickness from occurring. And so it's this dramatic change that is moving inpatient care, as Ms. Fry alluded to and showed in her graphs and in the slides. This dramatic change is causing a change from inpatient care where you stay in a hospital to outpatient care where you come to the hospital but you don't have to stay overnight. The other dramatic change, as exciting, is outpatient care when you come to the hospital and don't need to stay overnight, where you don't even need to come to the hospital and you can get care at home. It's always important for our team to think about a hospital and remember that a hospital really serves two functions. It serves a function of inpatient care when you come to the hospital and you stay in a bed overnight, that's inpatient care. But the other just as important function is outpatient care. And so a hospital serves a large function of outpatient care where lots of people come and touch the hospital but never have to stay overnight. These are some slides here that show the national trend of this move away from inpatient care to outpatient care. And so this slide shows inpatient days per 1,000 population, and you can see the inpatient care in the hospital. This is from the American Hospital Association data. Over the 20 years, there's a 32% decrease in inpatient care. Again, for some of the reasons that were stated. Also, for people that do stay in the hospital, for diseases that have been necessary to have hospital care, what this graph shows is the number of days you have to stay in the hospital has significantly shortened. Again, this is data from the American Hospital Association and shows over a 20-year period a 31% decrease in how long you have to stay in the hospital. So not as many people are staying in the hospital, and when they do, they're staying in a hospital for less. Also, as we talked about on the outpatient side of the hospital, so when people come to a hospital and use it for the outpatient purposes, dramatic increase in how a hospital serves a population. This, again, data from the American Hospital Association shows a 58% increase in the outpatient use of community hospitals over the last 20 years. The other trend we see is that a hospital also has an increasing need for emergency care. And that's what's another exciting part of this plan is the new family health centers we'll discuss will continue with full service 24 hours, 7 days a week, 365 days a year, emergency room service, because that is what is necessary in this community, and as this graph shows across the country, that's a need. I can tell you that my mother is an 86-year-old registered nurse, and she often tells me the story as I've evolved in my career into this responsibility, that when she was early on as a nurse, she took care of cataract patients. And maybe you're familiar with cataract surgery. And when she took care of cataract patients, she always tells me that the patient stayed in the hospital for 10 days, and her job was to move the sandbags back and forth from their head so you could not move your head back and forth for 10 days. and you see where cataract surgery has been, there's not a person in this country that gets cataract surgery and stays overnight. My personal experience is 25 years ago when I'm in my training as an orthopedic surgery, knee surgery was rare that anyone would ever go home the same day. Almost everyone stayed overnight with knee surgery. Nowadays, when you may have known someone who had a ligament repair for their knee, an anterior cruciate ligament repair, no one stays in the hospital for that. And I will tell you, over the last couple years, there's a trend across this country actually that knee replacement surgery is actually going to be done as outpatient. It's being done as outpatient now in many areas, and that's going to be a growing trend also. And the exciting thing, though, about this is that these changes, as you move from inpatient care to outpatient care and from outpatient care to home care, they actually lead to a better experience for the patient, better quality care, and exciting, at much more affordable care for the patient also. And it's these dramatic changes that are happening across this country, and as you can see, they're happening right here in Lakewood also. In 2013, there were 49,100 visits from the city of Lakewood, from people from the city of Lakewood to Lakewood Hospital. Of those 49,100 visits from the Lakewood city residents to the Lakewood Hospital, 94% of them used the hospital for an outpatient purpose. And I reinforce that outpatient purpose of the hospital is not going away. It's actually going to be enhanced with this plan with a new family health center to deliver better and improved and build on the excellent care that's presented at Lakewood now and further strengthen that need that 94% of the residents of Lakewood need the hospital for. Also, as Ms. Fry alluded to, the other need at Lakewood Hospital presently is the building is getting old. And so in 3 years, 83% of Lakewood Hospital will be over 50 years old, which leads to the capital requirements that would be necessary, as Ms. Fry discussed. So because of these changes and because of these needs, I can tell you that I and the Cleveland Clinic applaud Lakewood Hospital Association for going through this process and for being proactive to address the future healthcare needs of Lakewood and to develop a modern healthcare system that will be sustainable well past 2026. To develop this right model of care, we have to hear from you. And so I thank you for being here today, and I look forward to hearing what your needs are and what your concerns are. In addition to hearing from you today, as Mr. Gable stated, the Community Health Needs Assessment, which was done at every hospital across this country, also gave us good information to start planning on what's the necessary model of care to best serve the needs of Lakewood. And what we learned from that are the needs are access to preventive care, an environment that supports healthy habits is what you stated that you wanted here and what you needed here. There's also several diseases that have a high prevalence that are very common here. Those are pulmonary disease, adult asthma, congestive heart failure, and complications from long-term diabetes. The other need in this community is access to emergency services, and especially to mental health services and chemical dependency services. And there's also a need here for education to promote healthy lifestyles. So with the clear need to change the model of care in our country and the need to change right here in Lakewood, and along with the Cleveland Clinic's commitment to the Lakewood community, this opportunity allows the Cleveland Clinic to build on our over 18 years that we provided care to Lakewood. And it allows us to embark on developing a new, sustainable, futuristic model of healthcare in partnership with a very innovative city that will ensure Lakewood continues to get the healthcare they need today and the healthcare that you need in the future. I can tell you that the Cleveland Clinic is excited, and we feel very, very proud to have been selected to be your partner in this plan. As you heard, some of the details of the plan are that the Cleveland Clinic will build a 62,000 square foot family health center with a $34 million investment. The plan also calls for over $32 million to a new foundation with community governance of that foundation to promote healthy living. The $8.2 million that will go to the city for the medical office building on 850 Columbia Road. And also really exciting is the Family Medicine Residency Program and the Center for Family Medicine at Fairview will move here to Lakewood. But I want to stress that this plan is not just a building. This plan is much more than a building. It's a plan, and in order to address these community needs, it has to be a plan that's about programs also. And the programs are just as important, if not more important, than the actual building. Some of those programs that we looked to place are a tailored chronic disease population-based management program to focus on the chronic diseases that are most prevalent in this population. Other program will be specialty emergency service, such as the mental health and chemical dependency needs that are of a concern here in this community. This gives us an opportunity to develop those programs and, as a full-service emergency built, to build capabilities to address these specific services. Another exciting program are group visits. From preventive health and wellness to chronic disease management, group visits are effective in creating education and care environments that promote health and promote well-being. And they've been very, very successful in other areas. And another program certainly are prevention and wellness programs. Another need here is smoking cessation and weight loss. And to have those programs coming in here will be very beneficial as we together partner to go across this pathway to be the healthiest city. Specific services to be planned I'd like to mention. There are certainly the full service emergency department, primary care featuring an advanced patient-centered medical home model, extended hours and weekends to meet the need for better access. Radiology and lab services are planned for here, chronic disease clinics, family medicine and pediatrics, women's health, geriatric care, diabetes care, musculoskeletal care, brain health and behavioral health, and therapy services and many additional specialty services will be considered to meet the needs of the residents here at Lakewood. I also emphasize that this will be supported by the entire Cleveland Clinic health system. So there are more than 75 outpatient centers and more than 90 access points for the Cleveland Clinic across Northeast Ohio. And in that rare time when staying in a hospital is necessary, this community has a hospital that's approximately 3 miles away in Fairview Hospital and less than 6 miles away in Lutheran Hospital. And I also remind you that for the very complex and rare times when serious inpatient care is needed, there's the main campus of the Cleveland Clinic, located 100 streets east of downtown. And that's where people come from all over Ohio, all over this country, and all over this world to get complex and serious medical care. So in conclusion, I would like to stress a couple points. One, I would like to stress that the strength of Lakewood Hospital are the people that work there, and we, the Cleveland Clinic, are dedicated to them. The Lakewood Hospital employees have a very high level of experience in healthcare, and we appreciate their dedication and their contribution to the Lakewood community. It is our intent that every Lakewood Hospital employee who wants a job will be provided with that opportunity throughout our health system or one of our partner organizations. Second point, the Cleveland Clinic is proud to have been selected as your partner in this plan. The third point is that the Cleveland Clinic is committed to the community of Lakewood to develop a model of a sustainable healthcare delivery system to meet the needs of this community. And we see this as a great opportunity for an extremely progressive and innovative city to partner with a world-class healthcare system to develop the innovative future of healthcare by working together. And I leave you by just telling you that growing up, I saw my mom, who was a nurse, who I mentioned, and my father was a pharmacist. I saw them dedicate their lives to helping others. And I chose to be a doctor for the exact same reason, and it's that same reason why people choose to work at the Cleveland Clinic. We are committed to wanting to make people's lives better. We want to make a meaningful difference in the lives of our patients and of our communities that we serve. This plan is exciting. I can tell you it's personally exciting to me, it's exciting to Dr. Cosgrove, it's exciting to all of us at the Cleveland Clinic. It is a way for us to make a meaningful difference in the lives of this community, and it's an exciting way for us to see us be part of making Lakewood the envy of every single city in this country. Thank you very much for being here, and I look forward to your questions.
Well, I hope you can begin to understand why I said earlier this is a very complex conversation. So Nobody was more concerned about the financial impact of this proposal to the city than the two city council representatives, Tom Bullock and Mary Louise Madigan, and me. We have a city government to run, and we need funds to run that government. And the traditional relationship of the existing lease, signed in 1996, that would run through December 2026, pays $1 million a year of rent to the city of Lakewood, and we benefit from about $850,000 a year in payroll tax. Under the terms of this proposal, those funds would go away. So as a practical matter, our goal is to run this hospital through 2015 and most of 16. So the real impact of the loss of those two revenue streams would show up in 2017, roughly 10 years. So it's about $1.5 million in the end, because many jobs will stay here in Lakewood. Not all of them. There's about 1,000 employees, full and part-time, about 800 plus full-time equivalents, paying the roughly $850,000 in payroll tax. But several hundred of those will stay, so we won't lose all of that payroll tax. We estimate $1.5 million will leave the revenue source of the city of Lakewood starting in about 2017. You heard that we're going to get $8.2 million in cash from the sale of Columbia Road, 850 Columbia Road. In addition, we're going to get resources from the sale of the land at fair market value. And in addition, the city will also hopefully successfully conclude a tax sharing arrangement with the city of Avon. I've had conversations with Mayor Jensen in Avon. Avon has such agreements with other cities, and they are open to discussions about extending those agreements to the city of Lakewood on sharing probably half of their gain back to us for a period of several years, probably 5. We think that's worth about $1 million. We think the fair market value might be worth $500,000. You add it all together, we're pretty close to $10 million of revenues that we will get coming to the city as a result of this deal to offset and give us time to replace that $1.5 million. The real impact not hitting us till probably about 2021 or 2022. And I will tell you, it's about 4% of our general fund. It's a challenge for us. We've pared down our costs over the years dramatically, and we run a pretty lean government today. We're going to have to get a little leaner. We're going to have to figure a way to shed some additional costs, and we're going to have to figure some creative ways to replace some of those revenues. But we will have significant tools to work with. We will have 4 acres of land that will ultimately be redevelopable in the current site. We will have the current medical office building, at which point in time we do not get revenues from. Those go to the hospital trustees. We will get revenues from those buildings, the medical office building, the parking garage, and the community health center behind it. Those are assets. They have value. Who should best run them and own them remains to be seen, but nevertheless there's a monetary value there that will add additional buffers to us as a city government, providing even more time to deal with this revenue loss. And so we recognize it as serious. We are prepared for it, and those of us who are on the trustees have been aware of this really earnestly since about a year ago, and everything we do today is a mindful eye towards the challenge ahead, and we're prepared to meet that challenge. And we must do so without cutting services to our citizens, and we think that's achievable as well. So we have that conversation with our citizens as well, but I want you to be aware that we have substantial resources to offset those to give us time. So we'd like to hear from Ken Haber, who will give the Lakewood Hospital Foundation view of this deal and the implications towards the other foundations as well. Ken?
Thank you, Mayor. I don't know about you, but I have a back pain now after sitting on that stool for about an hour. Before I begin, for those who may not know me, my wife and I have lived in this community since 1977. We've raised our family here. Our 2 children have graduated from Lakewood High School. We are proud to live in this community, and we've done that by providing our time and treasures to various community and civic organizations. And so I just feel very proud of being up here tonight and speaking to you. I've been asked to talk about 2 important but separate philanthropic components that are involved or included in the letter of intent. So first I want to talk about the Lakewood Hospital Foundation and how this proposal impacts the existing organization. And then second, I will spend a few minutes to recap the elements in the proposal related to the establishment of a new community-based health foundation that Tom mentioned earlier. So let's begin with the Lakewood Hospital Foundation. For those of you who may not be aware, the sole purpose of the Lakewood Hospital Foundation is to raise funds to support Lakewood Hospital for their works and their activities. And we've done that successfully with the help of our donors over a span of nearly 60 years. Just in the last 10 years, the foundation has contributed close to $10.5 million to the hospital to fund various programs, services, and enhancements. In fact, just in the last few years, primarily driven by the way healthcare is being delivered today, we have actually supported more outpatient-based programs and services. For example, diabetes, brain health, physical and occupational therapy, radiology, and ER patient-based navigation. On behalf of the Lakewood Hospital Foundation Board of Trustees and its staff, we are very grateful to those who have helped support these efforts. So as I mentioned earlier, the sole purpose of the Lakewood Hospital Foundation is to support the hospital. And therefore, when in 1956 the foundation was established, it was structured to be a supporting organization of the Lakewood Hospital Association. In other words, the foundation exists because the hospital exists. And therefore, the assets of the foundation are included on the balance sheet of the Lakewood Hospital Association. And that's why the foundation is a partner in signing this letter of intent. Now, by signing this letter of intent, the Lakewood Hospital Association will no longer have an interest in the assets of the Lakewood Hospital Foundation, and thus allowing us, the foundation, to determine our future. We'll be free to pursue options that will allow us to continue our mission of supporting health and wellness initiatives, both here in Lakewood and in the neighboring communities, in such a way that will be consistent with our current and future donors. Now, upon initial review, and I said initial review, one viable option is the potential transformation of the Lakewood Hospital Foundation into a community-based health foundation. However, there are many governance and regulatory factors that have to be carefully studied before any decision can be made. So the first step is to understand what the consequences and the implications are of those factors. Once we understand that, the Lakewood Hospital Foundation Board can then consider various options on how to move forward. Equally important, and this is that any decision that will be made has to reflect the wishes of our current donors and our future donors. So for now, the Lakewood Hospital Foundation remains a separate entity from the new community-based health foundation. And now I'd like to transition over and talk a little about this new community-based health foundation that we've mentioned. As part of the letter of intent, more than $32 million will be invested to fund this new community health foundation with the intention to support community health and wellness both here in Lakewood and the surrounding neighborhood communities. I think Tom mentioned this earlier, but I'll reiterate it. The funding of the new community-based health foundation starts with an initial contribution of $24 million from the Lakewood Hospital Association's balance sheet. In addition, an annual contribution of $500,000 from the Cleveland Clinic will be given to support health and wellness initiatives over the next 16 years. This brings the total to $32 million. Now, as outlined in the letter of intent, here's where we are today. So the plan calls for the formation of a 21-member governing board with two of those voting positions appointed by the Cleveland Clinic. We anticipate a collaborative process by the four parties to look across the community for potential candidates to serve. Exactly how that money will be spent is still to be determined. This is a process, and we emphasize that nothing has been decided yet or finalized. We look forward, as has been mentioned before, to having conversations with our residents to solicit feedback in regard to funding opportunities. One last point I want to emphasize, that we have just started to define the governance, the purpose, and the mission of this new community-based health foundation. So although there are many details to be worked out and processes, in discussions I should say, collectively we look forward to meeting the goal of supporting and enhancing health and wellness in Lakewood and its neighboring communities. Thank you very much.
Thanks, Ken. All right, we're getting near your role here. First of all, I want to thank the Beck Center for their hospitality tonight. They have a play that they're building sets on behind us, and they were very accommodating to allow us to be here tonight. And in Lakewood, actually, we have these 488 seats, and then we have 1,800 seats at the Civic. And we were really worried about how many seats we'd need, and recognizing this would be a better place for us to connect with you as an audience. But if in fact there was substantially more than 488, the Civic would be the only other option, and we'd swim in that place. And it's not necessarily a good venue for having a dialogue. So we're grateful that we could be here tonight, and we're grateful that it could accommodate our needs. And we thank the Beck for squeezing us in. I noted that our State Representative Nikki Antonio came in. Nikki, thanks for being here. Nikki is a past City Council member and also a past Lakewood Hospital Board trustee as well. So we're now going to hear from you. So here are the ground rules. We'd ask you to come to the mics. And by the way, this is all being recorded by Cox TV, Cox Cable, and this recording will be on the city's website. So for those of you who found it so riveting you want to watch it twice, you'll have an opportunity to do so. And for those insomniacs who are looking for a quick way to maybe get some, become more drowsy at 3 a.m., it'll be available for them as well. But we do want to make sure that it's available, and will be as soon as Cox finishes the tapes and makes it available to us. So the point is, recording on the mics is helpful to us to capture your questions. We also have some members of the media, and they're particularly interested in your words as well. So here's the deal. You'll come to the mic. We're going to alternate sides. We're going to allow everyone to ask a question or make a comment. You'll be limited to 3 minutes because we want to give everyone a chance who's interested. If we don't get to your question, are the cards passed out, Melissa? Okay, we're going to be passing out cards if we don't get to your question, or if you're unable to get to the mic, we'll write your question down and we'll flag it, and I'll make sure we go pick it up so that we can perhaps have someone ask it on your behalf. But if you're not able to get to the mic, make sure we get contact information from you as to how we can respond to your question. We know there are a lot of questions. We've all had a lot of questions through the process. And every time we review our questions, we become clearer on what needs to be told. And we're anxious to address the complexity of this question. I'd like to ask Shannon Ritchie, who has already come up. Shannon is the interim president of Lakewood Hospital, so he's part of the Q&A team. And all the rest of us are available. They have a mic there. We'll share mics the best we're able here. 2 mics here. So let's hear from you folks. What do we need to make clearer, or what's on your minds? Yeah, if you're kind enough to come forward, that'd be helpful.
Good evening. My name is Robert Horrocks. I do live here in Lakewood. One question I do have: how do you operate an emergency room without an inpatient treatment option? That's something I just don't understand.
It's a great question. Dr. Donnelly.
Yeah, I think that's a very good question, and thank you for that. There's a concept of freestanding emergency rooms which exists, so all the capabilities of the emergency room exist and are built there with all services that are available in any emergency room. In those times when an emergency room needs further care, the patient emergency room, then that patient will end up going to one of the inpatient facilities that are close by. And this model exists right here in Northeast Ohio, and we have this in several different areas where it's very, very successful.
And I would say that it's a subject for us to consider in terms of our emergency medical transport protocols. It will change, require some change of who goes what and where, and what services we provide where, and those conversations are also beginning. And they're important and they're serious to us. You know, we do have the good fortune. In fact, a lot of our trauma runs today, we're going to Metro today from Lakewood. That's down the path. That's the level 1 trauma. Level 2 trauma is at Fairview. That's nearby. We have a lot of resources that aren't too far. And I would say in most communities, 3.5 miles away is local. We just have a little mindset that we're going to have to shift here, plus some capabilities. So we're going to be working on that. Yes, question over here.
Hi, I'm Ann Spence, and I'm here just for fact-finding. And I have one question after listening to everything. Is there going to be any surgical department left at Lakewood Hospital? And if there is or is not, I'm interested in knowing how many of the outpatient care given in like last year or the year before was due to people who were in the surgical thing. I was one of those. I mean, I had major surgery, was in at 7, was out by 3:30 in the afternoon. I'm an outpatient, but I was there for surgery.
Great. Dr. Donnelly?
Yeah, so I understand your question to be two questions. One is, will there be any surgical capacity at the new planned family health center?
Right.
And I can tell you, at the present time, there are no plans to have surgical capability in that family health center.
Well, then that will probably decrease the outpatient need at the new center too. Because a good number of the people, I think, were in for surgery and out the same day.
Yeah. I will tell you that I don't have the exact numbers of how many of the 94% of 49,000 patients.
That's what I was interested
visits
in getting at.
were outpatient. And I can tell you, I don't have that here today for you, but we certainly can get that information and can get that to you. I would still estimate that the majority, overwhelming majority of 49,000 visits from the community, 94% of which were outpatient, the overwhelming majority would not be surgical cases. And Shannon, I'm not sure if you have some more information on the exact numbers of outpatient surgeries that are done. Yeah.
Okay, thank you.
Yeah, we'll
work on
get that
getting
information.
for you. I
Okay,
think that-
thank you.
Tell you what, if you've got well, Lisa did explore that. We did talk about ambulatory surgical capacity. That was a lively conversation throughout a year and a half. I don't know, Lisa, do you want to comment about that?
No, I do not know the number off the top of my head either, but I'm sure we have access to it. And I don't know, Mayor, if you want to mention the website. We could
Yeah,
post
by
it
the
there.
way, we are going to create a frequently asked questions as a result of tonight, and that's going to be posted on the city's website. Is that up there? Yeah, onelakewood.com. There's a page. We also have a lot of agreements that are posted on the page. The PowerPoint slides will be posted. We have an additional 85 slides from the subsidium analysis that will be there for those who really want to dig deep. So everything we're doing tonight will be available to you through our website. So back to our question. Yes, over here.
Hi, my name is Rob Wetzler. I'm a lifelong Lakewood resident. I was actually born at Huron Road Hospital, and with the closing of Huron Road Hospital in East Cleveland, is there a similar emergency and community health-based center there now that's in effect? And also, closing Lakewood Hospital and the plan for building the hospital in Avon, why was the hospital here couldn't be saved when there's not as many people maybe living in that area in Avon, where there's the Elyria facility in St. John West Shore as well?
Dr. Donnelly?
Yeah, thank you for that question. And I think, help me just make sure I'm answering your question. The first question was over in Huron Road and what the plan and what the capabilities over there are.
Yes.
And in some ways, both of your questions relate, because we will regularly assess in all the communities we serve to make sure we're providing the resources and facilities that are necessary for the needs of that community.
Okay, please, sir. We've got a question on the floor. Yes.
And so there's Stephanie Tubbs Jones Family Health Center, which exists in East Cleveland, which is a significant commitment that we've made to East Cleveland. And I think one of the few companies that have made a significant commitment into that community exists. They do not have emergency room capabilities in that area, because when we looked at the need of that area and what the facilities were in that surrounding area, it was felt that those were not necessary there, so that more could go into programming for other reasons in that community. I can tell you in that community, what we've seen in the last year is we've seen a 19% increase in the use of that family health center, and we are very proud of that. I think I'd like to address your question about Avon Hospital, which is obviously a great question and very important question. That's another area where we look at a community and we see what the needs are of that community. We have a family health center out in that area, which has been a tremendous utilization of that family health center. And what we've seen in looking at the needs of that community are, there is a need for the patients that want Cleveland Clinic care to have an inpatient facility out in that area. We presently have a lot of patients that come to that family health center that cannot get care in one of our facilities because that is not there. So that is another decision similar to here, where we look at the community, we look what the needs are, and we work to try to provide and match our facilities and our programs to meet the needs of that community. Thank you for your question.
Question over here.
Yes, I'm Patty Thompson, and I've lived in Lakewood for many, many years. I have a two-part question, which Mayor Summers might have partly already answered. I would like more details, though. I see my Cleveland Clinic bills, and I see insurance reimbursements. If I wind up at Lakewood's emergency room and they decide I need inpatient care, who's paying for my transport? Who's paying for me to come home because I don't drive? How is that going to work?
So just so I get the question right, yeah. So you're a resident of Lakewood, you come to the emergency department at the Family Health Center, which is freestanding, and they say, this is pretty significant, we need to admit you to a hospital. Right. So then you get transported to an inpatient facility. Right. Because we don't have an inpatient facility at the emergency room that you came to, your insurance would pay for it just like any other ambulance run. You sure? So yes, okay. Medicare, Medicaid, and
no, I have
insurance.
Private insurance,
yes,
through my
or the private insurance would all pay for it just like they would any other ambulance service.
Okay, what about coming home? If I'm at Fairview, they can put me on a bus. If I'm in Avon, there is no bus.
Yeah.
At least
you,
Metro has
you may
a
be
van.
going to Fairview.
Are we looking into that or
yeah.
doing something?
Yeah, well, I would say that one of the things we've heard in the last several weeks in particular is this transportation question. It's an important one. And I would also say that transportation in Lakewood for many folks who do not have cars is a serious challenge for us, independent of this whole conversation
right.
of health care. I think as we think about the capability of this new health and wellness foundation, the $32 million that we're going to get, plus potentially more assets from the current Lakewood Hospital Foundation, I think we have the opportunity to craft some strategies to do a better job than we're doing even today to address some of the transportation needs of our citizens. And I think that should be a #1 conversation for us. And I think we welcome that and look forward to having resources to put to it.
Cool.
Mayor, can I just say one comment? I'd like to say one more comment because I like your question. And I don't see any need for a patient from Lakewood to ever go to Avon Hospital. So I don't see that as something that would be necessary at any time when there is a hospital that's 3.3 miles away that provides tremendous tertiary care.
My doctors all moved out to Avon.
I'm sorry?
I'm one of those people that increased the use at Avon because all my doctors moved out there.
Yes.
And I don't know if they were forced to or chose to, but...
But for inpatient care, I don't ever see a need to go that distance when there's a care that provides a hospital that provides great care 3.3 miles away.
Okay, thank you.
All right, next question, Mrs. Russell.
My name is Patricia Russell. I've been a Lakewood resident for all of my 80 years, and I've been asked to give this question from a woman with whom I work. She claims, and I believe her facts are correct, that the rehab center for strokes in Lakewood is the best in this community, will that rehab center still be operating with this new facility?
Dr. Donnelly or
Sure.
Mr. Ritchie?
This is the Outpatient Rehab Center, Physical Occupational Speech Therapy, and you're right, it is one of the best in the country. They do a phenomenal job. It is our intent to keep outpatient physical occupational speech therapy in the family health center, so that service would continue to be provided there. We're very, very proud of that, so thank you for raising that question.
But when my husband had his stroke, he was in Lakewood Hospital, so should he have another stroke, God forbid, would he be taken where? To Fairview? To Lutheran? Where would he go if that is not possible now in the new Lakewood facility?
Okay, so that's the other side, would be back to the inpatient side. It would be Fairview for the stroke care and the acute inpatient side of that stay.
And I may, as you bring up stroke, I'd like to tell you about a really exciting program. When I think of the opportunities that exist here in this plan, we have developed at the Cleveland Clinic a mobile stroke unit, which is out in existence right now, and has been functioning through Cleveland. And that's a unit that has a CAT scanner on the ambulance, and then has capability for direct communication to a team that can read that CAT scan and start treatment in a patient's driveway. It's one of only 3 cities in the world. There's one in Germany. Dallas has started this capability, and here at the Cleveland Clinic we've started this capability. And so this is a really exciting opportunity when I hear you ask that question of thinking of the possibilities of a new foundation that is able to have this much money to think of where to invest that in order to meet the needs of the community.
So then should I presume that he would be having home care and the care would come to our home?
I think the details of that need to be worked out, but I think it's a great possibility, and it's why we're here this evening.
Okay.
To hear from you, and I appreciate you coming up and mentioning that.
Question over on the right, my right.
My name is Donna Hoder. I live in Lakewood on Bell Avenue, the street the hospital is located. And my question is outside of the realm of the medical care. I may have misunderstood, and if you could set me straight, I'd be great. I thought I heard somewhere in somebody's presentation that there would be 2.5 acres of land involved with this. And the mention of the medical building is only a portion of 2.5 acres. I believe my house is probably within the boundaries of that. And I wanted to know, how would this affect the local businesses? There's a lot of small business owners near the hospital.
Great question. There's actually 6 acres of land on the main hospital site. That's between Marlow and Bell and Detroit heading south. And that's, in addition, there's the medical office building, the garage, and the community. That's additional acreage. I think the conversation we want to talk about in your case is the 6 acres. So roughly 2.5 acres will be used for the new family health center, leaving almost 4 acres available for redevelopment. Under the terms of this letter of intent, the Cleveland Clinic is responsible for transition costs, including any losses as we wind down the hospital, and including demolition, which is substantial. And there will be ultimately a green field of roughly 4 acres in your front yard. And the question is, what do we do with those 4 acres? And the options really are residential, retail, or commercial office. Industrial obviously is an option, but not for that spot. And we have just begun to think about the ramifications of 4 acres of redevelopment downtown. We have to be sympathetic to a residential neighborhood, and I know it's been quite a traditional tension between a busy hospital and emergency room and the residential neighborhood. So that activity will shift, and something else could happen there. We have that conversation ahead of us. We certainly are going to be talking to the neighbors, but that's going to be years in the making. But we do have redevelopment opportunities. Does that answer your question?
It does. Like I said, I also have a concern for the small business owners all along that block. There are a lot.
Yeah, and we have a couple of them here tonight. I did meet with Fatty Shimon of Aladdin's. He's thrilled at this. By the way, Brad Cowd, who bought Lakewood Center North, He thinks it's terrific. David Stein indicated his support for the investment of Plantation Homes. I think the uncertainty has been a burden on these folks. You know, what's going to happen, when is it going to happen, and what does it mean? Bringing activity, a different type of activity and a vitality is important. The worst case, we do nothing. We have an empty hospital 10 years from now or sooner, and we've got a huge demolition challenge of how you repurpose it. Those issues now have been acknowledged, addressed, and we have a plan. And I think the business folks seem to understand the implications, and they're relieved, I think, at this point. But not everybody, I suspect, but the ones who are directly involved, the Latins especially, you know, they obviously have a lot at stake here. They understand this, and they're supportive of it. So we'll have more conversations, though, about the redevelopment, lots more.
Okay,
Thank you for asking the question. Yes, over here.
I have a question on the Lakewood vocational program. Will it stay or go once the changes are made?
Lakewood location or program?
Vocational.
Oh, vocational.
I'm sorry.
Oh, well, that's a great question. There's a high school training environment. Good question. I don't think we've gotten that far yet.
We have not. I have had conversations with those folks, and initially I've told them that I'll reach out to Fairview Hospital. It is the West Shore communities have a vocational school, and those kids come to Lakewood Hospital, provide us a service. They get great experience. I know my fellow administrators at Fairview would likely welcome that. It's something a partnership we want to keep with the Cleveland Clinic.
Yeah, thanks for bringing that up. Actually, there's a whole lot of issues that are before us, and we're hearing about a variety of them tonight. We appreciate that. Back over here, Ken.
Thank you. My name is Kenneth Cooper. I live over on Broccoli Avenue. I've been a resident in and out of Lakewood for the last 25 years at least. And I have to say that the Cleveland Clinic, I think, has been an excellent partner with the city of Lakewood. I've been in and out of there as a patient and as an inpatient as well as an outpatient. I did not hear the number of residents that's been over to the main campus as a long-term patient that maybe at one time would have been in Lakewood as a patient to offset some of the costs, but I realize the medical field has specialized in a lot of areas, and through the specialization, it has shortened the stay and created, you know, possibly deficits. I don't know if the state or the federal government would be able to come in with any funds to sustain and maintain the hospital as we have it right now. And my question right now, does Lakewood have any ownership in the new facility that's going to be built on the site? Thank you.
Yeah, I think the 2.5 acres of land will be sold to the Cleveland Clinic at fair market value. They will build the building, they will own the building and the land. The terms of the agreement at this point is the city of Lakewood would have the right of first refusal to repurchase the land at the price we sold it for, or fair market value if it's less, if in fact the clinic were ever to decide that it was no longer going to be the provider. So that is an element of a control we've tried to build in, but it's important we understand this will be a clinic-owned, clinic-run facility. Fair statement?
That's a very good answer, Mayor. Thank you very much. The land, if that this new Cleveland Clinic Family Health Care Center will occupy, will never be out of, let's say, the control or option of the city of Lakewood having. If they ever ceased operations, it would revert back to the city at fair market value, but never greater than the amount that the clinic paid the city for. So there's still some control there. And then the opportunities for the other development are on the balance of the property.
Thank you.
Hope that
Being
helps.
a former real estate agent, I was in competition with Lakewood when they bought the corner of Marlowe, the commercial site,
Yes.
and they outbid me. Thank you.
Thank you.
Yes, over here.
Hi, my name is Carol Wilson. I've worked in Lakewood and own a home here for about 35 years. My thought is this. The clinic has been responsible for managing Lakewood Hospital for almost the last 20 years. And during the course of that 20 years, I mean, the clinic's been excellent at managing Fairview. They're according to the statistics, the 4th most profitable hospital in Cleveland. a lot of the services that were present at Lakewood have been moved to Fairview or other facilities. And therefore, the income from those and the patients that could have filled Lakewood's beds are elsewhere. It's almost like, you know, the old thing about death by 1,000 cuts. And now we're at the death part. It probably is far too late to try to do anything about Lakewood Hospital. I mean, I'm not foolish enough to think that we could do something to change that now. It won't happen. And the healthcare industry has changed. That's fine. But what I also find very curious, being a hospital administrator in my former careers, is it's going to be so easy with the facility in Avon to have this ready-made, well-vetted, wonderful staff just go out there and not have to be searching for anybody. Wow, how lucky are you? I find that to be totally amazing.
And that's why we want a tax sharing agreement with the city of Avon, I tell you.
Oh, absolutely. But finally, I think given the responsibility, in fact, that the Cleveland Clinic should assume for the state of affairs, given that they had that management for all those years, perhaps they should be willing to, you know, do some construction with the elderly garage that's there so Lakewood doesn't have to assume that responsibility and that expense in fixing that place up. If, in fact, as I understand, Lakewood is going to agree through this agreement to provide the parking for those employees that are going to be working in the facility.
Yeah, and actually that's been a lively conversation as well, and I appreciate your asking it. Tom?
I could comment briefly on the latter part of the question about the hospital parking garage. As we transition through the definitive agreement and by virtue of language already in the letter of intent, there will be significant structural improvements in the existing parking garage now and an ongoing plan, if you will, maintenance plan to keep it up to date and safe for the future. There's been a lot of money spent in the last 3 to 5 years on repairs and maintenance and new lighting with the LED technologies and whatnot. So that will continue, but that is a concern, and it's part of the terms and conditions that still have to be worked out.
And the first question about transition of services from Lakewood Hospital to Fairview or other places and the impact that's had on Lakewood. Dr. Donnelly or Mr. Ritchie?
I'd like to look at the converse and what the Cleveland Clinic has done for Lakewood Hospital and what they have brought to Lakewood Hospital. The Neurological Institute has come to Lakewood Hospital as a Cleveland Clinic based program. We are the west side hub for neuro. If anyone has a stroke in the west side of Cleveland for the last 5-6 years, Lakewood Hospital was the place that they were brought to. I'm sorry?
I'm glad, because I almost had a stroke when I heard all this.
Secondly, the Lorraine Institute physicians. So there are orthopedic surgeons.
He's answering the question.
I am answering the question. This is...
Yeah, he's...
The orthopedic surgeons, general surgeons, and ophthalmology have brought a tremendous volume of surgery to Lakewood Hospital that we would not have otherwise gotten if we had not been affiliated with the Cleveland Clinic. And then lastly, the Great Diabetes Program that was talked about earlier was enhanced, certainly since my time there, by bringing in a second physician, doubling the number of visits that we could see, and really providing a greater care to that disease that we know is a critical disease in this area.
But isn't it also true that a group of orthopedic surgeons has been brought over from Lorraine County to kind of hang on to them so that they can operate there while they're waiting for their Avon facility to open?
I think that's the Lorraine Institute he just talked about.
Yeah, that's what I mean. It's like...
Yeah. I think those, in that particular case, those orthopedic surgeons have many opportunities to operate at many different places, and they were brought here to Lakewood. There's excess capacity throughout our system, as there are throughout all the systems here in Northeast Ohio and across the country. There are 800,000 hospital beds in our country. 65% of them are utilized. 35% of them aren't utilized, and there's similar statistics for operating rooms also. So that was a conscious decision to bring them here. Okay. I want to tell you that I completely understand yours and all of your concern about what is happening. There are two aspects that I think of to the hospital. And when I think of going forward, I appreciate Lakewood Hospital Association, Mr. Gable, Mayor Summers, working to provide how this can work for the best for Lakewood going forward. And I think that 94% of the utilization of that building is for the outpatient. I'm excited about enhancing that part of it.
Alrighty, question back over here.
Yeah, actually I've got a couple short questions. The equipment that you've put into Lakewood, Hospital, you know, the new MRI, you've got X-ray, CAT scans. Will that be remaining at this facility so it's still more convenient for this community?
It's a good question. So the emergency department services will remain uninterrupted at the hospital and then in the Family Health Center, along with all the radiology services, including MRI and CAT scan, as well as an outpatient lab and outpatient physical and occupational and speech therapy.
Okay, and the emergency room will continue to be 24/7?
Yes.
Okay. When is the projected completion of the new facility, and what will happen in between the time that you closed on the current one and opened the new one be?
Yeah, that's a great question. And your question is, I think, when will the new Family Health Center be up and running? And I can tell you the timeline on that all depends on the working through this definitive agreement and getting approval of the definitive agreement. Because when that happens, then we can start on the timeline. So the exact timeline is being sorted out. I can tell you as we work towards the definitive agreement and come to that understanding, those details will become much more clear.
And we'll have plenty of conversations as we move through this process. Okay. First of many here.
Thank you.
Yeah, thank you.
Bill?
Bill Grulich, third generation Lakewood. First of all, I'd like to congratulate Dr. Donnelly on his promotion, leaving Lakewood.
Thank you.
Congratulations. Secondly, I just want to say that I have two questions. That my parents' lives were saved because of the proximity of Lakewood Hospital. And my father-in-law's life was saved. Stroke, heart attack. And it is because that Lakewood Hospital was there that they saved their lives. The second question that I have is that you see that this is a public forum, and I noticed in the letter of intent, Dr. Donnelly, that you specifically, or the clinic, wanted 90 days, and that's what you gave here in Road Hospital, 90 days, to come to an agreement. And I just wondered, is there any room or flexibility on that?
I can speak to that from a subsidium perspective. We were involved in that discussion, and the 90 days we suggested we put in place as a part of that, just to not let this linger as an undecided factor. But the agreement does allow for automatic, mutually agreed upon extensions, so it doesn't have to be 90 days.
You realize it is a public.
Oh, yes, absolutely.
I mean, in 90 days in public life is
and all this
not
discourse
very
needs
long.
to happen. While that 90 days really was just for the point of negotiating what would be a draft of the definitive agreement, and then there's a whole process involved, obviously, with approvals of once that document exists for everybody to really learn what's in it.
My next question is for Mayor Summers, and what were your discussions with Metro Health? And will you release that information to the council and to the public?
Yeah, no, actually, I'm glad you asked that question, because I think there's some flesh on the bones of the local partners. Did we talk to UH? Did we talk to St. Vincent's? Did we talk to Metro? And the answer is we did. Lisa actually did some of the negotiations. I personally talked to University Hospitals in 2011. I personally talked to St. Vincent's in 2011. And there were more formal conversations with both those players. We had 2 meetings with our narrow strategic group and the Metro group. We never got a written letter of intent from them. There was some serious interest on their part strategically about starting off as a family health center and considering whether or not they would consider running at the community hospital. That was it was a very exciting possibility, and at the beginning of October they withdrew their interest. So it went away.
One last question. The audited statements that are supposed to go back to council from Lakewood Hospital, I opened that up, and are those made public?
They can be and should be, yeah, absolutely. I think we'll get them on our website.
So ever since the agreement with the Cleveland Clinic up until the present day, those audited statements are going to come out forthcoming?
And Ken, would you want to address the audited statements? We've had them every year. Ken was the finance chair of the Lakewood Hospital Trustees and perhaps can answer that more forthrightly.
Yeah, so those are available, and as Mayor Summers said, we can have those posted, but it is available, and all you need to do is ask for them.
So, I mean, for the whole public, I don't think we should have to ask for them.
No, I was referring to the past, and so certainly today, absolutely. Absolutely.
No. We'll get them on the website, Bill.
Thank you.
Back over here.
Hi, my name is JT Newfer, and I lived in Lakewood for the last 14 years. And I'm here tonight to kind of share a personal story with you. Sometimes you don't realize how important something is until you have to use it. About 4 months ago, my mom had broke her foot, and she went to the hospital at Hillcrest to get the surgery. Unfortunately, some complications happened during her therapy time, and she was back into the hospital for a period of 4 or 5 weeks. And things were really complicated because of her diabetes, and so we had some challenges there. She did recover at Hillcrest, and she went back into another nursing facility on the southeast side. And unfortunately, a few weeks later, she had another infection in her foot. This time it was MRSA, and it was very dangerous. And so unfortunately, you know, her foot was really badly infected. And through several conversations with doctors, due to her conditions and her age, my mom is 75, and she has severe diabetes and kidney disease. Unfortunately, they could not save that foot, and she had to have an amputation. At that time, it was a tough decision for our family, but we want my mom to walk again, and we want her to be healthy. She currently is still in the hospital. We were given the option of having her sent to Lakewood Hospital or Euclid. And the reputation that Lakewood Hospital has, in particular to the acute skilled therapy, is what we ended up choosing. So for the past 21 days, I, along with my family, have been there every day, championing and cheering her on to get her healthy so she can walk again. It was tough for us. It's a life-changing experience. It's not easy. It's very emotional, as you can tell. But we really appreciated what Lakewood has done. And personally, you know, I want the residents in Lakewood and other people to have that same option. It's been a really great experience for her. She is getting better. And the nursing staff has been outstanding. So I really appreciate what Lakewood Hospital has to offer. And I'm just afraid and concerned that if these things aren't available to our residents, they may not have the same opportunity, or they may not have the same support system. So I wanted to share that story with you today. I know this is a tough decision for you and the mayor and our elected officials, and it's tough. It's not easy to make. But I think it hit home to me, and I hope that people in the audience today in our community realize how valuable and important that this hospital is to us. And I just ask you to think about some of these things as you're going through deliberations, and be thoughtful of what other people need in the near future.
Thanks, JT. Back over here on my left.
Mayor, can I just say
sure.
one comment? I just want to tell you, I really appreciate you coming up and sharing that story with us. And when I came here this evening, these are the kind of input that I would like to receive as we look at what services are necessary and what are most important. I will also tell you a story personally hits home with me because I am an orthopedic surgeon, but all I do, my specialty, is foot and ankle. And I've seen many, unfortunately, I've seen many patients like your mother, and I'm very familiar with that situation and the emotional investment that goes in from a family to a loved one that has to go through something like that. So thank you for coming up and sharing that with us.
Thank you. I do have one question here. The nurses that have been working with my mom and the doctors, I am concerned about those folks losing jobs, and what is the plan to help them retain their employment with the clinic? And some of these people are Lakewood residents. I work in the industry to help people find jobs. It's not easy. I hope there's a plan that you will look at that and help these folks get jobs and continue in their life, especially here in Lakewood.
And I can tell you, I, in the Cleveland Clinic, shares the exact same concern that you have. There's a little over 1,000 caregivers that work at Lakewood Hospital, and approximately 190 to 200 reside here in Lakewood. It is our intent that every employee at Lakewood Hospital who wants a job, that we provide them with that opportunity. We presently, in our system right now, have over 1,000 openings in our Cleveland Clinic health system. So we will provide an opportunity for every person that wants a job. And that's the intent we have.
And I would say one of the advantages we have is we try to be proactive to get ahead of these curves. We have the element of trying to run a hospital for a year and a half or more, and then we have transition issues. So there was an enormous amount of respect on the part of the trustees of the fragile relationship between an employer and its employees. And we felt it was vitally important that whatever announcement happened between the employer and the employee first. And then the rest of us should hear it shortly thereafter. And so once the decision was made on January 14th, the employees were informed at 8 a.m. on January 15th, and we announced it to the public at 10 a.m. on January 15th. And that relationship is important to the clinic and was important to the trustees, that it be honored and protected. And it remains certainly something that's very important. We do have a hospital to run, by the way, and we hope to run it for many, many months into the future, a year and a half or more. And we're going to need these employees, and I think you've made that commitment to them as well. So,
thank you, Mr. Mayor.
Yeah, back here.
My name is Tara Peppard. I live on Edwards Avenue. I've been a resident for the past 6 years. My name is Tara Peppard. I'm a resident on Edwards Avenue. I've been here for 6 years. When I chose to move to Lakewood, one of the reasons was when I drove down Clifton Avenue and I saw Emerson Elementary and how grand that was. Lakewood Hospital, which, when I did some research, when I heard the story that we were going to lose our hospital, I thought, by God, I didn't want to see yet another historically, beautiful place be destroyed. And I didn't speak up before Lincoln was torn down, and I thought, I'm not going to miss this meeting. Lakewood Hospital has served me. Again, I chose it. I chose to live in this community because I thought, my sons, there's an emergency room right there. And yes, thank you, I'm glad that we're not going to lose our emergency room. I have my family health center at the YMCA down the street, okay? And there's a history with Lakewood Hospital. 1908, it is the first hospital in the Cleveland suburbs. And yes, the new building was built in 1917, and yet I'm hearing yet again, destroy the whole building, don't preserve this historic architecture. There are enough eyesores when you drive down Detroit Avenue, there are enough vacancies. I love this city, I love it. And all I see is a destruction of things, and not the integrity. And I'm very concerned, and I do hope there's some way Metro Health find some other alternatives. There's got to be alternatives. The birthing center, most people I know have had their children at Lakewood Hospital. And I didn't know, I had no idea about the stroke center, how strong that was. There is viability. I didn't see in Ms. Frey's slides, I didn't see anything about looking at the viability of that being a birthing center. This is a haven for families, Lakewood. Avon, we're gonna go out to the suburbs again? Like, this is further outer suburbs? No. Okay, I beg you, I am here because I don't want to see another, the Lakewood Hospital, there's history. 1917, that modern building, and yes, there have been creative ways to save the hospital, and I really beg the leaders in this community to do something about it.
Well, there's several elements to respond, and we should. First of all, the architectural and historical piece. We have a very vibrant architectural board of review. They've pushed a lot of the recent investment to much better positions and designs than they would have otherwise been. I think we have elements of being able to respect and reflect our historical dimension. I think that conversation will also be starting, that we haven't talked about designs and architectural issues yet. No point in doing it until we come to agreement on the issues that are before us. But we have a well-proven process by which we address designs. And that process today delivers far better designs than were built in the 1960s, 70s, and 80s in this town. And much of what you described happened in a different era. So we are respectful of that. It's a challenge. Build something that will last the next century and still be mindful of the old. And we accept that challenge, but it's not easy. I think the elements of birthing, I don't know if anyone wants to comment about that. And the pattern, we do have 35% of our population are millennials between 21 and 39, and their health needs are a different subset than others, and we need to make sure that we understand those and are reflecting them as well, but it's likely to be in an outpatient environment. The midwifery program, I think, is expected to stay, and I understand that today many of these midwifery clients are interested in home births. So this thing is changing in a very radical way, and figuring a way to accommodate that is part of the lively conversation we're going to have. Any comments on the clinical side on any of that?
Just on the OB, and sadly, as I've shared with our employees, we don't have an answer yet. Over the next 90 days or so, as Ms. Fry pointed out, we will be working on the definitive agreement. At that time, we'll have specifics on the OB program and how that program will continue.
Okay. Ryan?
Hi, I'm Ryan Salo, lifelong resident. I just have a couple quick questions that don't involve a lot of answers. Did the clinic initiate the discussion to close the hospital, or did the association initiate that conversation?
The clinic did not initiate the conversation.
Okay, thank you. So, what hospital would want to come in if the association is against having a hospital?
The association was not against having a hospital. The association was mindful of the fact that we needed to investigate other opportunities.
Okay, but you went to the clinic first to say, hey, we're exploring alternatives. Do you want to bid on it, correct? You approached the clinic.
Ultimately, after the study was done.
Okay, yeah. That was the only question. All right, and it's actually back to you. In the last press conference, you made, and I don't know that I got it right, you made a statement saying that the closing of Lakewood and the opening of Avon were mutually exclusive decisions, and the fact that they're happening at the same time is merely a coincidence.
Completely coincidental.
Do you still stand by that?
That's true.
Do you still stand by that?
Pardon me?
Do you still stand by
that? I do.
Okay.
I do. Those were completely separate, isolated processes to come
now
to
lastly,
those decisions.
Thank you. Lastly, were any other council members, besides the two that are on the hospital association, aware of these potential changes?
I think council should ultimately address your question, but I will tell you that we had two representatives representing council, their interests, and I did have conversations with council. I would say this thing began to crystallize in terms of what was happening and what was not happening in the early fall. I had conversations with members of city council then about what it was likely to look like. And around this whole letter of intent really gelled about December 18th or the 22nd in that weekend before Christmas. And I had meetings with City Council on January 5th in the week of them explaining in detail what this letter of intent was likely to look like.
Okay, and one last question. Is City Council going to have the right to alter the future details of this plan in regards to location, size, ownership, or are they just going to have a pass-fail vote?
Well, I think that's all yet to be determined. You know, I think council's role is clear. They can only, they're the only ones who can grant me authority to sign a contract. And if they don't do that, for whatever reasons they choose, then, you know, we're going to be talking about different options.
Okay, thank you.
Ryan, thank you very much. In all due respect to Ryan's question about the Avon versus the Lakewood decision, we have to be respectful of the 23 volunteer board members. This decision and this process was undertaken by them at their own initiative to fulfill their responsibilities as fiduciary stewards of the Lakewood Hospital Association. The clinic independently analyzed their patient load, their doctors, their Lorain County patient needs, separate from Lakewood's needs. We were not considering when Avon would open, how many beds it would have, whether or not our employees could be employed there. Coincidentally, for wonderful employee transition opportunities, that's the way it looks. So superficially, I completely understand if somebody thinks that there was some mastermind somewhere that put the two together and had this idea at the outset. But I assure you, and in respect to the other 22 trustees, including the mayor and the council members, you'll find out as you're learning through this process, that was never the case. It was independent, and it was the initiative of that board of trustees to find alternatives to declining revenues, declining volumes. And I thanked Bill earlier. He said he was third generation Lakewood, and I'm one of the few, maybe I'm fourth generation. My great-grandmother, Mrs. Lorig, grew up on Northwood Avenue. Her daughter, Henrietta Lorig, was my father's mother. My father recently passed away in September, age 91, after 4 weeks in Lakewood Hospital. Two of my grandsons were born at Lakewood Hospital. I worked there in 1965. I worked there again from 68 to 75. My mother was a candy striper volunteer there. I had my tonsils out there in 1952. I grew up in Lakewood. I went to St. James. I went to Lakewood High School. I'm not a stranger to Lakewood. I know, and I feel just as emotionally as many of you do about your perception that this is our loss. But believe me, this is a gain. This is an improvement. This will be healthcare of the future, and you all, through this learning process, can be part of it, and your input is going to help form the foundation, the mission, and the purpose of Lakewood Health Foundation. And I please invite you to continue to ask the questions, continue to learn the facts, and be respectful and understanding that these were not easy decisions. They were very well thought out, and every stone was turned. I mean, we left no stone unturned. We tried to vet and investigate, and you can talk to your friends and neighbors that are fellow board members. They'll be glad to share that information with you. They're all, many of them Lakewood residents, as I mentioned, some physicians, attorneys, and nurses, people that are involved in their community. But thank you for that moment. Ryan, thank you for the right question. I appreciate that.
I think we're back over here.
My name is Marley Nottage Harvey, and I've lived in Lakewood for over 40 years, and I'd like to make a comment about Lakewood Hospital. I spent 12 days in ICU, 30 days in hospital, 6 months in physical and occupational rehab, and I have been treated in other Cleveland Clinic facilities, main campus included, for various surgeries and rehab. But I can tell you without a doubt, Lakewood Hospital, they're dedicated professionals, from the doctors to the cleaning people, are the best team I've ever worked with, especially physical and therapy rehab. They are outstanding, and I would think that Lakewood would keep physical and therapy here in Lakewood because of the aging population, the stroke patients, and all the heart patients. And if it wasn't for that rehab unit in Lakewood, I wouldn't be standing here today. I would be at McGorry's, which is not a bar, but a funeral home. And I can't thank them enough for what they did for me. Thank you.
You want to comment, Dr. Donnelly?
I thank you very much for your comment. Thank you very much for your comment. And I can tell you that I, and I'm sure Shannon, share your passion for all the employees at Lakewood Hospital. Thank you.
And back to the rehab clarification. I mean, parts of it are going to still be there, correct? Yeah, the outpatient?
Correct, the outpatient.
Right, DL?
My name is D.L. Meckes. I'm also third generation Lakewood. The years that my family has been associated with Lakewood Hospital are long. My mother Eloise served on the board for many years. The lack of transparency in this process has been truly disturbing. And I want to know, is the plan that is the plan going to be made public on the website so that the rest of council and the public can see that and you know, look at every detail that was looked at?
Yeah, the 85 slides have already been delivered to City Council. They have them.
I don't mean slides. I mean the whole report. You mean you got 85 slides and that was it?
Well, the slides are the analysis and the recommendations, includes recommendations.
Was there more than slides?
Well, the slides today include a lot of commentary about the strategy that led up to the LOI, letter of intent.
So that's not all the information, it's just portions of it, is that correct?
No, I think the 85 slides. Lisa, you want to comment about the content of?
We put in that 85 slides all of the relevant and pertinent data analysis that we conducted that led through each stage of that process that we talked about tonight. So obviously
that was all that was delivered to the Hospital Association and the city?
I have not counted the total number of slides, but we could certainly provide more detail. What we tried to do was boil down the information into the most relevant material. I mean, you all are welcome to weed through hundreds of slides.
I'd love to see it posted on the city website.
That would be fine.
What did the Hospital Association do to ensure that the clinic was fulfilling its contract?
Those are annual compliance issues, and they are adhered to every year.
Have they been made public?
They're the compliance issues as to the existing definitive agreement, and they're always public every.
Are they also on the city's website?
We could put them there.
That'd be
Put
great.
them there, yeah.
Anecdotally, when I went to the emergency room not too long ago, I got to see the big wheel of failure in the way that Lakewood Hospital Emergency Room delivers services. And by the way, they couldn't detect whether or not I had the flu. So services in the emergency department have really, really gone downhill. And I'm just shocked at the way the clinic has handled the business of Lakewood Hospital.
Okay. Mrs. Graham.
Yes, my name is Coletta Graham, and I do want to start by saying that as I sat here tonight, I noticed a lot of people are starting to lift up their feet in regards to what has transpired tonight. I want to thank two doctors a long time ago that prophesied what was going to transpire once the clinic came in. Their names were Dr. Kilroy and Dr. Carey. And I'm going to try to get an answer from somebody in the hospital in regards to the treatment that has been done for my husband and myself. I recently left the emergency room. I had to go in and they did x-rays. When the orderly pulled me out, looked into my room and said, "Oh my God, make sure you clean that up before she comes back." It was absolutely filthy, absolutely filthy. I went up and got x-rays. I came back and I said to the orderly, I said, "I'm sorry, I'm not going to be able to get to my room. I have to use the washroom." So they said, "Oh, well, there's one right here in the hall." It was by the nurse's station or the doctor's station or whatever. So I went in, used the washroom. I came out and said, "Why isn't there any soap in the dispenser to wash your hands after using this bathroom?" And nonchalantly was told, "Well, just use the other sink." So this was my experience as far as the emergency room was concerned. Now I'm going to try to get an answer, and I don't want to hear any rhetoric about it. My husband has participated in the heart exercise facility that transpired in the atrium. Over 100 people participated in this. This went on for quite a while, and they loved it. There was camaraderie among these people. They were all patients that had heart problems, heart surgery. My husband's partner walked with him. He had a heart transplant. They loved this. Out of the blue, pulled. Oh, was it put in Fairview Hospital or a hospital setting? Oh no, let's put it in a rehab school out on Worcester Road. I want to know why you dropped that facility. There was absolutely, do you think they got it done for free? They paid for it. They were more than willing to pay for it. But hey, this clinic has gone out of their way to stop services, cut the pediatrics ward, cut as many things as they did. I mean, you had Mr. Fitzgerald propose an addendum to the existing thing to get rid of the trauma center. It just has gone on. And I'm going to say one more thing, because my husband needed to have surgery. He had had it done in Lakewood Hospital 2 other times. He had the same doctor. So the 3rd time, we were told, no, you have to go to Fairview Hospital to have the surgery done. And after the surgery, I said to the doctor, I can't understand why you're making us come out here to Fairview Hospital. There was never any complications. He did fine. Why are you doing this? Why didn't you do this in Lakewood Hospital? And he said, I'm sorry to tell you this, Mrs. Graham, but I am under the clinic now, and they tell me where to go.
All right.
Wait, one last part of this. Just one last.
You're way over your 3 minutes, and we have a lot of folks
No,
who
I
are...
just want to finish this, what happened. We had to go back a week later. Did we get to go to Lakewood Hospital for this test to see if it was functioning fine? No. Did we go to Fairview Hospital to get this function done? No. They made us go all the way out to the Avon facility to get this test done. It's unconscionable what you've done, but it's not because you've had the okay from City Hall, the 23 board members who I called and tried to find out about the heart exercise unit. Mum's the word. Mum's the word.
I'm not sure whether there's a question there other than the rehab piece. That's the question I think Mr. Ritchie is about to answer.
So the cardiac rehab program was moved because of free surface parking right outside the door at the Rocky River Wellness Center.
Okay. Where are we? Back over here.
She wasn't a plant, but I'm Dr. Terry Kilroy.
I thought this was okay.
I grew up on the west side of Cleveland. I went to St. Ed's. I've had a house in Lakewood for 30 years. I've been a member of the medical staff at Lakewood for 30 years, and I've had an office across the street for 30 years. The real credentials that are important, though, are Lakewood Hospital has served my family for 3 generations. I mean, my grandmother, my uncle, my wife, my mother all died at Lakewood Hospital. When my father and I had MIs and strokes, we went to Lakewood Hospital. And it gives me a great deal of pause when I think that the next time EMS comes for me, it's not going to be there. Okay, last fall I had another neurologic event in an ER West.
Up to the mic, please.
Last fall I had another neurologic event and it ended up in an ER west of here, and it took them 3 hours to get me anywhere they could do anything to help me. Luckily, my brain fixed itself, so I'm still here today. One of the things that I think we all have to do is there's a lot of magical thinking going on now on both sides of this issue. Okay, the first piece of magical thinking is that Lakewood Hospital is survivable, which it is not. Okay, we can waste a lot of time pointing fingers at why this happened or when it happened or who is responsible, which are things that, frankly, you can sit with me fishing with a couple of beers and we can have a nice discussion. But it doesn't change where we're at. The hospital has been functionally dead for probably more than a year. Okay, we have a facility that's more than 50 years old for the vast majority of it. The only renovations in the last 15 years have been the 2 wards the Cleveland Clinic used, orthopedics and acute rehab. The one that was for the benefit of anybody else, which was the CCU, was closed within a few months of opening, which was great planning after we blew a few $1 million there. The medical staff has basically disappeared. When the clinic took over, 90% of the doctors were people like me. People who grew up in the area, stayed in the area, were committed for our entire careers to the population that we served. Basically by a decision by Mr. Loop, or Dr. Loop rather, that he wasn't going to support our recruitment to replace the independent physicians. We have all aged out such that if you look at the core medical staff of Lakewood Hospital, we're all in excess of 60 years of age. We're all in excess of 60 years of age and essentially have no way to replace ourselves. The clinic has not filled in the gaps developed by us. The third thing is our service line has basically disappeared, okay? We've moved cardiac surgery, thoracic surgery, trauma, oncology, essentially ENT, psychiatry to other Cleveland Clinic facilities. It's a little disingenuous to say our population has gone down and our patients don't go there, because essentially they can't go there. I mean, I used to send cases for, I'm a lung doctor, I used to send cases for thoracic surgery, ENT surgery, and oncology. Right now, every time I refer, it has to be out of Lakewood Hospital, and those patients never come back. So the decrease in population is kind of disingenuous. The problem is, you look at it objectively though, the board is right. The hospital's not survivable. Our only chance of survival would be an investment by a very large, deep-pocket organization. There's only one willing to do that, and that's the Cleveland Clinic, and they would frankly rather invest in 120 beds in Lorraine than 120 beds in Lakewood, okay? The second piece of magical thinking is that the Cleveland Clinic is going to save us, okay? That they're going to be able to give us health care, okay? The first concept is the concept of preventive care will solve all problems is Peter Pan thinking, okay? The bottom line is, my parents both had MIs when they were in their 40s, okay? I did all the preventive care, I took my pills, I kept my blood pressure under control. And I really did pretty well until I had my MI in my 50s. Now that's still an advantage, and it does show you that preventive care happens. But none of us are gonna get out of this life alive. All that preventive care really does is it delays the onset of the chronic or serious illness. And so we still have a significant population in Lakewood that has chronic and significant illness. All you have to do is go look at all the nursing homes on the east end of the city, look at all the assisted living home facilities we have, and you realize that there is a large core of people that already have their chronic disease, they already have their serious disease, they're going to need hospital access on a fairly regular basis. Severe COPD patients like I take care of, on average, are going to be hospitalized 2 times a year with respiratory failure. Okay, right now they go to Lakewood. We can establish a relationship with them, we can work with them. Unfortunately, now they're going to be going all over the place. So, I mean, I think the bottom line is, if you really look at this contract, all the clinic is doing is putting in an office building, okay? You're going to have their insurance, you're going to have to pay their copay, you're going to have to pay their facility fee to go there. The less advantaged members of our community are being left out in the rain. And although, the public confuses things, it says, well, preventive care is the way to go, and if we look at this, there's a new model of medicine. Well, what they really don't understand is I, as a doctor, get paid about the same amount of money to take care of you when you're in shock in the ICU as to take care of you when you're having a well asthma visit in my office, okay? So to say we're going to commit to preventive care is really a doctor economics issue. It's people saying that we're going to commit to where the money is, not to where the need is. And the basic problem is the Cleveland Clinic is not going to change any of that. These are just medical offices. They have 20 facilities like this they call family health centers all over the county and all over the state. And this is not going to be anything different than that. So for us to say that they're going to come and make our health care better is completely fantasy thinking. Now the third piece of magic,
and by the way, we've got folks who want to ask questions. We're well past 9 o'clock. So
the third,
I want to be respectful.
Okay. You're actually going to like this part, Mr. Mayor.
I'm happy to let him talk, but I just want you to know we've got folks
The third
behind
piece of magic really comes from the phrase that a small, dedicated group of people can change the world. And what we really need to do is the city of Lakewood needs to take responsibility for the health care in this community. We've been kind of asleep at the switch, all of us, the doctors, the citizens, the people running the thing, and the hospital died because of that. So we have to figure out what we're going to do prospectively. Okay, what's number one? We need development in the city because we got to find a tax base to replace that $1.5 million. Okay? The decline of East Cleveland is partially because Huron closed and they lost that big chunk of tax base, and we don't want to get into this problem of increasing taxes so people won't come and decreasing services. So we have to develop the city. So that's actually number one. Okay, what's number two? We need to have a discussion between the citizens and the government about what the fiduciary responsibility of our elected officials is to us as citizens. Because right now, I don't see where we have a big involvement in that. Foundations are fine. They're not transparent and they're not accountable. I think we need to have a citywide discussion about where does the accountability go and where is the transparency so that we can hold the politicians who are basically controlling this process to the needs of the community. The third thing is we need to develop an infrastructure that can deliver that, okay? If you think about it, the Department of Health was closed a few years ago, which would be the normal vehicle to basically monitor, delineate, and organize the care of its citizens because of the fiduciary responsibilities of the government. That ended under Mr. Fitzgerald's administration. So right now, we have a very nebulous accountability. We have almost no, basically no openness to what we're trying to see and do here. And so I think the real magic of all this magical thinking is we've got to be realists, okay? The people control the process. We need to meet with our politicians, and not with the clinic, and not with UH, and not with Metro. We need to sit down and decide what we're going to do. Now, what's the last piece? We've got to retain as much of the assets that we possibly can. Okay, one of the problems looking at the letter of intent is some of the pieces are missing that we need to know. One, how much is the hospital selling the property to? Number two, how much is the demolition and closing costs going to be? Because if the clinic gives us $24 million and we spend $24 million tearing down the building, we're at a wash. The third thing is there's nothing in the agreement. The clinic gets all of our hard assets, all of our equipment, MRIs, cath labs, et cetera. It's not stated in there what's the value of those things. For again, are we really getting anything from the clinic, or are we just shuffling the money around? The final thing is the 850 Columbia building. I mean, I'm a doctor. I've looked at buildings to buy. I pay rent. 100,000 foot thing, 20 bucks a foot, $2 million income a year. And they're telling me that a 100,000 bed office building in Westlake, which has an ER in it, which has a surgery center already, generates $2 million a year in income, is only worth $8 million, while the building that they're putting up here, which is much smaller at 62,000 square feet, is going to cost $34 million. So, I know we got a nice person from out of town to take a look at this, but, a couple of us in the doctor's lounge today said, at that price, the doc should buy that building because that's a hell of a deal. It pays itself off in 4 years. And so, I think we need to have some kind of dialogue between the people and the government, and the clinic is not part of that. They should be people who do what we want to do, what we've organized to do. They're really good at delivering service if you can delineate what you want. Our problem has been is we've let them run the show, and they're frankly not into that. The Cleveland Clinic is a very rare entity. Most hospitals were developed by cities for fiduciary responsibility to the citizens or religious groups for stewardship. The clinic was started by 4 guys who got unhappy with UH and wanted to go into practice and run their practice their way. It's about them. It's not about us. Individual doctors may care about you, but the organization does not.
Thank you, Dr. Kilroy, for sharing that. There's a lot to think about and a lot to follow up, and we'll certainly make contact with you. Over here.
Good evening. My name is Dave Stasko. I was born in Lakewood, grew up in Lakewood here. I have a couple questions. Will this new facility have a helicopter pad so that when somebody comes in and needs services that can't be provided, so they can quickly be transported somewhere else? The second thing I see is that by closing Lakewood Hospital, you're exposing every resident who goes to Lakewood, needs to be hospitalized, an additional $500 minimum to be transported somewhere else. And the third thing I see is for the elderly here is that they, as far as to be able to go out and to drive, even though it's 3 miles away, logistically, if they choose not to drive, and as they get older, a lot of them, like my parents who lived here in Lakewood and raised us here and passed away here, how can you expect them to go up to Fairview to visit their loved one who's in the hospital? Even if you ride, we have the best public transportation here in the area, you still have to take a bus, a train, and another bus to get to Fairview.
Couple points. The transportation question we acknowledge we need to improve on. We look to this new foundation to provide resources. And just to point to Dr. Kilroy, the demolition and transition costs are on the Cleveland Clinic's nickel. The foundation money is not at risk at any point. That money is going to be there to serve the needs of our citizens as we define it. And that is a community conversation that we're going to have. Transportation, we agree, that's a challenge. We're going to work on that. We have some resources.
Reference to the helicopter.
Oh, the helicopter, yeah.
There are no plans to put a helicopter pad here in Lakewood to make the 3-mile trip to Fairview, I will tell you.
Okay.
Okay, what other?
So
Other question?
The third was, what about transportation? Are you talking
Yeah, well, we
transportation?
acknowledge we've got some work ahead of us.
Here's my other thing. Is the clinic willing to provide, you have beautiful shuttles downtown. I work 5 minutes from the main campus. You willing to provide shuttles for people who don't drive so that their loved ones can go out and visit those that are at Fairview or Avon? I don't think it should be the responsibility of the city. You're running the facility.
So I think in reference to the mayor's comments, this is a need that is going to be investigated and looked at as we move to a definitive agreement to help solve that problem.
Yeah, we've got some work ahead of us there. Okay, thanks. Over here.
Okay, my name is Nancy Roth. I'm a former councilperson for the city of Lakewood.
Hello, Nancy.
And I was on council when we entered into the lease agreement with the clinic, and we had discussions a lot like this, that the clinic, that at that point it was concerns about the market and being able to compete and to keep ourselves financially viable. And the clinic signed a 26-year lease with some things in it that we were led to believe would help to keep us viable. So I have a couple of questions. One is, with this, the lease theoretically has 11 more years on it. So this ends up, the lease disappears, is that correct?
Yeah, if it's, in fact, it's all approved, the current definitive agreement would be unsigned, and a new agreement would replace it.
Okay, and then my other question, I have a couple more, but another question is, I just want to be sure that I understood correctly that when there were decisions made to move services out of the hospital, that was done by the association and not by the clinic. Is that correct?
No, a decision for clinical services would not have been made by the hospital board. It would have been made by medical management, the management of the hospital.
Okay, because some of those services were included in the lease, and I don't know that current, somebody told me that it's been amended.
It has.
But,
In 2010, there was an amendment to those provisions of service expectations.
So that allowed them to move these services out because, okay. I have a couple other questions, but a lot of them were answered. The council's going to be asked to approve a letter of intent. Is that correct?
Incorrect. Actually, council will be ultimately asked to approve the new detailed agreement, which has not been drafted yet.
Okay, because the letter of intent that I received from the council office is non-binding, which to me means nothing. Okay.
That's correct.
Okay, and in terms of the needs of the community, there's a lot of disabled people who live here because of the transportation, the public transportation system that we have, and also we are an aging community. So I would hope that any decisions about what services are to be here would take those kinds of things into consideration. I was very concerned about Mrs. Graham's comments that a health program was moved out of the hospital. I don't know why. And I think Fairview Hospital owns the facility up on Worcester. I'm not sure about that. But it seems if you have services that are being needed and used by the citizens, that those should be encouraged and not moved out. And I just want to say, I understand, I'm also glad to hear that the Avon project and the Lakewood project are not linked, although I find it very coincidental that those things are brought out together. I'm going to be brief, but I just want to say, I understand the healthcare system pretty well. And I just want to say that I think it's very important that we not get tied up in talking about how much money somebody's going to make. I mean, the clinic is building hospitals all over the world, so they're doing okay. And but I think we need to be very sensitive about the needs of the people who live in this community. The reason we are involved is because it's a public hospital. The public has supported this hospital for many, many years. They're nonprofit, so they're not paying taxes, and I think it's extremely important that we not get driven off the path of what the community needs onto the path of how to make as much money as possible. Thank you.
Thank you, Nancy. You know, I do think it's important that we get one point clarified in terms of the Avon versus Lakewood Hospital. One thing that was clear to the trustees is that the Cleveland Clinic brought in business from Lorraine to shore up our volumes, which we desperately needed. You saw those graphs, 2008, 9, 10, significant financial losses. The clinic brought business to stabilize the financial performance, and that business disproportionately came from Lorain County. The linkage, the honest linkage is, those are Lorain County citizens. They're going to want service in their backyard just like we do. And the clinic has recognized that competitive nature, and they're going to build a facility to address that local need. And that, unfortunately, puts a serious dent in the volumes currently at Lakewood Hospital. So the link is that volumes were brought in by the clinic, and they're going to leave. Those folks are going to have choices in Lorain, and they're going to have Cleveland Clinic choices. And we're going to lose that volume, and frankly, the world looks very, very different when that new facility opens up. So there is a relationship. It's not strategically necessarily do one at the expense of the other, but it does have definitely an impact on us. And we know that. We knew that. And we grew to understand that the world looks very different in 2016 when that Avon facility opens up, because that Lorain business will go back to Lorain. And that's a fact, and we can debate the hows and whys, but nevertheless, the viability, as Dr. Kilroy pointed out, we have to be realistic about what's going to happen. And we can talk about a world of the old model, but the fact is the trustees came to understand that the current state, certainly in 2027, was probably nothing. We would have no health care here. And we didn't want to be in that position. And we did everything we can to understand how we could address the realities and make sure that we had health care that made sense. It isn't what we would consider it. We would consider it honestly very good options for us. You know, what would be great? Great would be Fairview Hospital in Lakewood. We'd probably say that's great, but that's not the reality we have to deal with. So I do think it's important that we have some frank conversation at that point. Where are we?
Mayor, can I just clarify
sure,
one situation? I'd just like to make a comment about the building of hospitals all over the world, and that the Cleveland Clinic is involved in a project in the United Arab Emirates, and a new hospital is going to open there that will have 360 beds. We have been asked by individuals in the United Arab Emirates who are completely building and funding that all by themselves. We've been asked to come and manage that hospital. So there is no money from the Cleveland Clinic that has gone into that hospital and into building that hospital, and the money from the management of that hospital actually comes back to Cleveland. I just want to clarify.
Yeah, thank you. Which side are we on? Over here, thanks.
My name is Melissa Nadial, and I'm a resident of Lakewood, and we've lived here for 9 years. And I just had a couple of comments. I was, thinking about the hospital out in Lorain, and that, maybe we will lose some patients there, but I think there are already hospitals out in Lorain. And so I guess I look at that as from my understanding, that maybe that's a good place. Anyways, I guess I don't really want to make a judgment about that. But what I did want to say is that my husband is a cardiologist and he works at Lakewood Hospital for these last 9 years. And we moved to Lakewood so he could be close to the hospital. He's very dedicated, and we're 5 minutes away. And I know that he goes there in the middle of the night and on weekends and takes time away from our kids and me to go do that. And I just wondering, what's he gonna do? He works at other hospitals, but Lakewood Hospital is part of where he works. And I guess the point I was making too is that that there are patients who need him. He gets up in the middle of the night to go see them. And I also know, I don't know what the time frame is for a heart attack, like how soon you have to get to it, but I think it's within an hour. I think there's a 60-minute period that you have to get to somebody before they have heart damage. I don't know. I'm not in the health field, but I think it's something like that. And, I think, so time becomes critical. And that's why he gets up fast and goes when he gets a call. And so I just wanted to say there is a need here for him. And and what's going to happen to him when he's, what's going to happen to that part of his work when, and I had one other thing that I appreciated so much what Dr. Kilroy said, but I don't agree that you have to give up on Lakewood Hospital. I think you could still, in its current fashion, do some reorganization and some remanagement and make it better.
Okay. Any response on the cardiology?
I would tell you that for your husband being a cardiologist and for many, many other specialties and disciplines of physicians, there's an overwhelming demand for people like your husband and other physicians. And we look to support those physicians to help partner to develop programs that provide for the needs of the community. So I think there's a massive demand for your husband and the services that he provides. And I would welcome the opportunity to talk to him to get his input, how he is best utilized.
I felt like that all these plans were being made, and I kept thinking, are these guys talking to the doctors? Like in all this discussion, I didn't know if you were talking to the physicians, because you didn't talk to him. No one talked to him. It was all like rumors. People would hear things and...
We have several physicians that are members of the Board of Trustees, and they were very important to the conversations. Some of them, a few of them are clinic physicians, several are not. And they were critical to our understanding of the landscape and their views. And they worked hard to represent the views of the physicians.
Okay, it just seems like it might have been good to choose physicians that weren't already inside the decision-making process, just to hear a real view of what was happening.
We had some of each, and they were both important.
Mayor, could we have, I'm sorry to interrupt, sure. We have the opportunity, I'd like to answer that question with a communication plan that was developed.
So as the mayor mentioned, the physicians on the board as well, since the decision has been made, we've had a physician forum. And I have been out talking to all the private practice physicians. Your husband's on the list. I've been to 17 since the announcement was made, and we'll continue to talk to those folks. And again, as Dr. Donnelly said, look at opportunities of how we can help them and how we can work through this together.
Right. That's right.
Okay,
That's
let's be respectful of the folks at the mics, please. Rick?
My name is Mark Schneider, and
Mark,
I wanted to start by thanking you, Mayor, and thanking the panelists for having this public dialogue. I hope it's the beginning of this public dialogue rather than the end-all, be-all. I think if they had had an opportunity to rethink this, they probably would have put chair backs on the stools. I also want to thank so many of our city officials and our state officials as well who've been here, and for those of you who don't see that, city council members are taking diligent notes, and it's clear that they have an interest in learning and really understanding this. I've been talking to, it's obviously been a large topic of conversation between my neighbors, my friends, about this decision. I think many of them are still at the point of kind of shock and trying to learn as much as they can about the situation that the city and the hospital are facing. It occurs to me in talking to these folks, it's very clear that the hospital is viewed as a public treasure, a public point of pride, and a public trust. And as part of that, I think there's a feeling of ownership amongst my neighbors, that they want to be a part of this process and feel that they were given enough information to understand and support whatever decision is made. It occurs to me in listening to the process that while many of us were brought in at the end here, this is a multi-year process you've outlined. Ms. Gray is here from the consulting firm, and we've talked about the 88 slides. A lot of the questions they have as far as the situation we were facing, the choices, the alternatives that were sought, and the final decisions, my guess would be involved in the work product of the consulting firm. And while we talked about 88 slides, the difference between the 88 slides and I think the information that some of the folks here and some of the folks I've talked to are looking for might be more represented in reports and presentations that took place over these couple of years. For instance, we talked about in these slides that there was a process where there was a discussion on is the status quo viable or should there be a change? And while that was noted, there wasn't really a discussion about the meat of that discussion, about what determinations were made before moving on to the next part. There was a slide talking about we considered alternatives. But the meat that I think these folks want to know and understand is what were those alternatives and why were they ruled out in favor of the choice you're putting forward to us. So what I would suggest humbly is that, that in any way possible that you make available to both the council as well as the public any reports and further presentations that were generated as work product by the consulting firm. I think that would go a long way to help us try to reach a public understanding.
Sure. Remember, we announced at the beginning, this is the first of many conversations. We wanted to lay out the broad strokes and get a sense of where the details are that we want to bear down, and we're prepared to do that. Back over here.
Hi, my name is Devin McKay. I'm a resident, grew up in Lakewood, love Lakewood. My question kind of echoes something that was brought up earlier, which is there any consideration being made to save the historic building or facade or the Curtis Block building that's on Marlowe's Corner, because that's our only remaining original 4 corners of buildings, and it didn't appear on the published design plan for the new facility. And I think Lakewood prides itself on history, so why do we continuously demolish our history to replace it with new development? There are no specific design plans. You know, we worked hard to get to the broad strokes of the letter of intent. All that work is before us. There are no specific plans. Those conversations are and will just begin. And you're all invited to be part of it. You know, the design elements there's a formal process in Lakewood upon how we consider designs of new buildings. And it's driven by the Planning Commission and the Architectural Board Review. And those are public conversations, and you're welcome to attend, and we'll do our best to make sure you know. I just don't want it to look like Crocker Park.
Neither do I. Over here.
Hi, my name's Don Benko. I live on Bell Avenue, right down the street from the hospital. I grew up in Hall. I went to St. James, St. Ed's. I was born in Lakewood Hospital. My family's been in Lakewood since 1940. And growing up, I was a very good patron of their emergency department. Along with my my son's now 27, and he was a good customer as well, and you did a great job. And believe me, I know I probably made a lot of BMW payments for a lot of doctors there, too, in the meantime. Okay, with that being said, I have 2 questions. One, obviously you can't operate the hospital the way it is. Why couldn't we go ahead and shut down half the hospital, turn it into like a skilled nursing facility, keep the other portion viable, like they did down in St. John's? And the other thing is, with this being an older population, sooner or later these people are going to be passing on, and hopefully we're going to have some younger people moving in. Like to revert to downtown Cleveland, eventually that's going to hit the suburbs, maybe 20, 30 years from now. If you look at long-range planning, what's going to happen if Lakewood does need a hospital? Like, let's say we have something catastrophic happen, like an Ebola virus or something major happen where we're going to need a hospital. Lakewood's landlocked. We can't go ahead and just, once you tear something down, it's gone. You just can't go ahead and pitch tents in the backyard, you know? And that's
and I would say those options were reviewed and discussed. Lisa?
Sure. So I can comment on the first half of the question, which was, did we look at other options in terms of downsizing?
Half the hospital down and leasing it out.
Downsize the hospital, and we did some estimates, and you know, we looked at we estimated that if you were to, you know, keep us a very small hospital here, it'd probably be 55 to 80 beds. This is information that's in the slides. We looked at the cost of what that would, you know, involve in terms of retrofitting the hospital, and you know, unfortunately, many of those decisions came down to economics. When you look at, you know, unfortunately, the healthcare system in general does not generate humongous margins typically. So you have your average community hospitals actually, you know, most of them barely break even. 33% of them actually lose money every year. So we were looking at an investment upwards of $50 million, between $50 and $100 million to keep this as a viable inpatient facility for the next 20 to 30 years. And unfortunately, the resources of this community did not, you know, allow for that type of an investment to be made. So we did look at that as an option. Okay. I think the other thing which a clinician would probably be better able than me to comment on is that There is a great deal of literature in healthcare these days about the concentration of volumes and the connection between a high frequency of procedure and the quality of the care that you get. So we had concerns about a hospital being too small to be a high quality institution as well.
Okay, my second question is, suppose there is a need later on. Like suppose we have something
pandemic,
catastrophic.
It's a good question, and
Once it's gone, it's gone.
Yeah, it's true. But I would say, just from a business perspective, funding something that might never happen and you can't justify today would be a hard financial burden on someone, the owners or the city. And I think we do have this Ebola scare. It changed the way we look. We had it here locally. Terry Allen, who's in the room, Commissioner of Public Health in Cuyahoga County, led some very serious conversations among all of our communities about what we're going to do and how we're going to do it. And it was a dry run, fortunately for us, but it was a recognition that in many respects we're not prepared for that, but we need to take our game up. In terms of inpatient capacity of a pandemic, a 1917 flu, that's a conversation we ought to have, and not tonight, but we ought to have it. And it's a broader implications of our society and in our region. So we'll do that, Don. Thanks.
Okay.
Over here, Paul.
I only have observation or maybe remarks that I wish would have tell us sooner than after Lakewood Observer's Jim Bryan wrote that article. I wish we could have done this sooner than this. I think that we would have saved a lot of problem. Trend of outpatient. Well, there's no way a patient can tell a doctor that I'm going to stay a couple of more days. So it's not a trend from the patient side, but it's a trend from the doctor's side to send you home. No one wanted Lakewood Hospital, as per Lisa's saying. Well, probably one of the reasons is that who would want to take on a $5.3 billion company like Cleveland Clinic is? I mean, who would want to do that? And I would really like to see a couple of slides or some explanation. How many dollars does Lakewood lose compared to this $5.3 billion company that we cannot maintain? Or tear the whole corner down and build a new hospital? And if anything, I am look at all this. This is practically all about how do we get a dermatology department into Lakewood? Not one.
That may be the easier question.
Not a single one, not a single one. I started 1960, who was our mayor?
That was Bob Lothrop.
No, I mean, I
1960
started in Lakewood
Frank,
to live in 60.
Frank Celeste.
But this thing of trying to find a dermatology department started not that far back because I was still young enough that I had no problem. So I don't need any answers. Just,
well,
these are just
and those are good questions.
Just think about it for the next meeting.
And this is all being taped, and we
Thank you very much.
We'll gather all this. Thanks, Paul. Back over here.
Can all you senior citizens hear me? Okay. Qualifications. I was born 89 years ago in Lakewood Hospital. Lived my entire life in this city. I've been a homeowner for 60 years in the same house, and I feel that I own a little bit of that hospital. I've been a patient there on a number of occasions within the last year. And I want to say I would never go any place for better care. The attending physicians, the nursing staff, talented, caring. It's obvious I can't say more. I want to say that I am vehemently opposed to closing the hospital. You have not convinced me tonight, and I hope in the future months that you can. I would suggest everybody read Dr. Kilroy's letter to the editor that appeared in the January 20th Lakewood Observer. I am a little disappointed in his conclusion that this is a done deal, that the citizens of Lakewood have no input in it that I've been involved in. I want to comment on the room usage. And this has probably been covered before, but it seems to me that the clinic has eliminated so many of the, I'm searching for a word, you'll have to excuse it goes with the age.
Services.
They've eliminated or taken away so many of the services that would occupy beds. If you cut down on the services enough, you won't need any beds, okay? Which is essentially what you want to do. In closing, I would encourage the administration and the council to hold off until you get a little input from the citizens of Lakewood, who indeed are the owners of this hospital. If they want it, I think we should keep it in some manner. Thanks for your attention.
And I know that City Council plans to have those conversations. You'll have opportunities.
I appreciate the time, and
thank you. All right, we have 2 more questions.
Oh, I have a question for you, Mike. Excuse me. Where were you born?
Lakewood Hospital.
There you go.
And I had a lot of surgery there as a kid. I mean, I'm attached to it. It's been a great help to 3 generations of my family. So I understand the emotional issues. And I think all of us have a very strong attachment, one way or the other, to Lakewood Hospital and what it's meant to our health. Okay, over here.
Hi, I'm Marguerite Harkness. I'm a Lakewood resident since 1965. It seems that there are certain medical specialties where time is of the essence. Our cardiologist's wife over here explained one of them. If her husband has to drive 40 minutes through freeways to get out to Avon to treat a patient who should have been at Lakewood Hospital, that's a problem. Neurologically, you've said that Lakewood is supposedly the stroke center on the west side. When we had a neurological incident just a few years back, wound up at Lakewood Hospital at about 8 in the evening on a Saturday. They did not have a neurological doctor available or on call at Lakewood Hospital, and my husband had a brain bleed. They took him at 3 in the morning to Cleveland Clinic by an ambulance that cost $1,700. They wouldn't let me take him in my car. So we were down at the clinic. The 18 hours in the clinic cost $18,000. There was not a neurological doctor on hand at Lakewood Hospital, and you're telling me this is the neurological center for the West Side. I'm not so sure about that. But that's neurology and heart are 2 where the doctor's living in Lakewood so he can get to Lakewood Hospital in 5 minutes at 3 in the morning. There are certain specialties where you ought to be able to keep people overnight and have the right diagnostic equipment here, and certain other kinds of surgical or semi-surgical, I don't know, heart cath lab, I don't know what these would be, but the cardiac doctors would know that. That should be available on hand here, where we live and where the doctors are 5 minutes away. The other specialty where all of a sudden you need help is when the baby's on its way. Lakewood is getting older and it's getting younger. We have a lot of us who are approaching our senior citizen years. We also have a lot of young families that are moving in to the homes of the folks who have gone on. And these families, when the baby's on the way, Fairview's a long way from here. So I think certain specialties need to be, you need to figure out how to keep people overnight and have what they need in the critical day, or the 1 day's time of their medical needs. Thank you.
Thank you, Marguerite. I want to be respectful of everyone's time. It's almost 10 o'clock. We're happy to be here to answer your questions, but I do want to be respectful of those who have a big day tomorrow and might want to adjourn. So I guess the question to those questions that have yet to be asked, we're happy to take them individually. If that makes sense, what's your pleasure? I guess maybe if those of you would choose this time to leave, you're welcome to do so. Those who want to stay, you're welcome to do so, and we'll just keep taking questions. So maybe we'll just leave it at that. So we understand it's late, 10 o'clock. It's 5 minutes. Which side are we on? We're back over here.
I'll be brief. My name is Steve Alexa. I'm a 20-year resident. I'm a nurse, so I'm just one of the doughboys in the trenches of healthcare. Question from my wife is, have the first responders been consulted about the change to the hospital system? In other words, have they been appraised as to the fact that we'll have a standalone emergency room, or do they feel the transportation to Fairview or to Lutheran is adequately short?
And that conversation, and that conversation is an important one. It is a lively conversation. Certain protocols are going to have to be adjusted. Time en route, time out of the city, those are factors of service. We're going to have to make some changes to reflect some of that, but absolutely. Chief Gilman has known about this strategy for several months and has been putting a lot of thought and is leading that conversation on behalf of the city.
And my short question to you, Mr. Mayor, and the members of council is, it seems to me as if the clinic wants to break off the engagement and keep the ring. If there is adequate response time to get to these other emergency rooms, has the council and yourself considered other uses for the 6 acres right in the heart of our downtown? If we're going to lose the hospital regardless of our best efforts, and I understand the economic necessity and the hard work that everyone in front of us today has put in coming to that conclusion, have we considered anything else that property might be beneficial for?
You mean the current physical structure?
No, I mean the current physical property itself. If the clinic destroyed the structure, can we put up a civic center? The YMCA the nice lady goes to is completely packed, for example.
Yeah, well, we will have 4 acres to redevelop, and those are appropriate conversations to have. So yeah, in fact, it's a very important conversation for us.
Well, I understand that isn't the one for this time, and I thank you for asking my questions.
We don't have 4 acres of land downtown, but every 100 years, and we're going to about to have that opportunity.
That was my real concern.
And we better get it right. That's for sure.
Mayor, can I just make one comment? I would just like to say that you as a nurse are one of the most critical persons who provide health care throughout any healthcare organization. And I just want to make sure we acknowledge that.
Thank you. Bill?
Bill Trentel. I have one question for the consultant. How many additional times have you been engaged by either the clinic or other clinic-involved entities?
None, 0. So we've never worked for the clinic.
Okay. I want to thank the mayor for bringing us into the 11th and 3/4 hour to bring this backroom deal to the light of day. Remind council they have about 75 days to sign off on this.
They have more than
It
that.
seems like it's already obviously a done deal. My other question is, I mean, here we are again. We went into this 26-year deal with the clinic, at least on the city's behalf, in good faith. Now we walk away. Every 5 years or so, they've come back to us. The city has bent over backwards with promises that, oh, you're going to be our heart center. Well, that never really took off. That was moved out of here. You know, if you reduce these services, we'll make you our heart center. Well, that didn't work. We were going to be the rehab hospital for the great Cleveland Clinic. Well, obviously now we're being told that that was the promise made when we reduced our ER level about 3 years ago. Now, once again, here we are, our supposed civic leaders are embracing a partner who has proven to be a non-faithful partner. So what guarantees do we have that once the physical plant is gone, they build their curtain wall building at the corner of Bell and Detroit, are they going to say, well, you know, an ER is not profitable, we're going to close that down. And, we have free parking out in Rocky River. It's not too bad for most Lakewood people to get to. And plus, this new Civic Foundation is going to pay for a bus ride there. Yeah. So what guarantees do we have that the clinic is actually going to fulfill any of this promise when obviously the last contract, they weren't willing to fulfill that contract?
Tom?
Thank you very much. Now, briefly, the clinic's always been willing to fulfill its contract. It was a 30-year lease, still is a 30-year lease. We're still in a 30-year definitive agreement between the city, Lakewood Hospital Association, and Cleveland Clinic Health System, and that hasn't changed.
But every time they've asked to reduce the services involved, we've been over backwards and agreed to those. So it's a one-sided agreement. We agreed to give them the money, to give them the services, but
it appears,
we don't get anything back.
And what you're saying, I won't disagree with because it appears superficial. But again, if it's a clinical decision that you have to concentrate your care in a certain clinical modality to get quality and safe health care, what would you prefer? Now, the choices weren't necessarily always ours to make.
The multinational Cleveland Clinic Foundation, the residents of Lakewood are an insignificant decimal point on a spreadsheet.
Right. Not insignificant at all.
It's up to, not you, you're obviously on the board, you don't live in Lakewood. You're not one of us. It's up to the mayor and the council to be the buttress for our interest.
Yeah, and he's done a great job, and so has
I'm saying here we have 75 days to come to this decision, to sign off on this agreement that more than likely will never be totally fulfilled by the partner we once again embrace.
Well, I'll have them speak to the commitment, but it's a commitment to your health care. Dr. Donald?
If you have the right insurance.
I will tell you that we are committed to every community that we serve. And we regularly assess the needs of the communities that we serve and try to match our resources and our facilities to meet those needs. And we are committed to Lakewood for the long, long term. This plan is a massive investment when we look at investments that we make. We would not be interested in this investment if it was not a long-term investment.
Well, in reality, it's PR chump change. Because you know as well as I, if you put the padlocks on the door tomorrow and walked away, that'd be bad PR. So you spend $100 million, you put a building on that land, and you can slowly continue to until, finally, it's not economically viable, we're out of here. What guarantees do we have that you are going to serve the citizens of Lakewood? We thought we had that with our 30-year contract, but obviously we don't. What guarantees does this new agreement have? I see less agreement because obviously we're selling the land probably at a discounted price, and we're taking over all the assets that are going to be obviously just a burden around our taxpayer necks. A falling down parking garage and 3 medical buildings that are worthless because why would a doctor want to be here? There's no medical facility.
This counterpoint it has an appropriate place. Bill, I'm not sure we're going to convince you, but there are points that are worth pursuing, but I am sensitive to other questioners. Tom?
My name is Tom Monahan. We live on Waterbury. My wife Marianne and I bought a house 38 years ago, I think it is. It happened to be the house that Dr. Lee Graber built This happened to be the house that Dr. Lee Graber built in 1904 and mortgaged to build the first Lakewood Hospital building. So we have a keen interest, despite being here for 50-some years in this community. Question, one of the gentlemen was bringing up there, this is the third time to my recollection that the clinic has come back to us to make more changes in this solid agreement as they're referring to. And I had 31 questions I had pulled out of this letter of intent, so I'm not going to burden you with those tonight. But I had one question I want to find out. What services are going to be available at Lakewood Hospital from now until the clinic decides to close it?
So the intent is for all the medical surgical floors to remain open. There are some other services that, until the Avon Hospital opens in the fall of 2016, there are several other services that won't be provided at Avon. We don't know the final details of all those until we work those out over the next 90 days and we have a signed definitive agreement. So we don't have an answer. The answer is we don't have all the answers right now.
It is our intent to keep Lakewood Hospital fully functioning until the fall of 2016. I will tell you, as was referenced earlier, that safety and quality will be the driver of every decision that is made.
A neighbor of mine brought over a letter that she received signed by you about apparently what's going to happen to the community. And another neighbor called. I've been on the phone more than probably council with people bugging me about this thing. But the fact is, a lady was supposed to have surgery and her doctor said, you can't go to Lakewood anymore. You have to go to Fairview.
I don't know the particulars of that situation. I'd be happy to look into that.
I'll try to get you the name if they want to talk to you.
That'd be great.
Okay.
We'd welcome that.
One last point I want to ask was, what was the impact, the financial impact of pulling out all of the programs from Lakewood Hospital that was done a number of years ago? Trauma center, everything that was pulled out and shipped over to Fairview.
I can speak to two programs that were impacted based on one of the changes that you talked about. And those two services are trauma and pediatrics. The trauma program is an expensive program to run because you have to have physicians on call who are able to get to the hospital in a short period of time, and you need to pay all those physicians to be on call to be available. And when we transferred the 2 years prior, we had one trauma visit at Lakewood Hospital per month for the prior 2 years. The other program was the pediatric program, which requires a minimum staffing level, so you have to have X number of nurses and assistants and a secretary on that unit. And again, the prior 2 years before moving that service, we averaged 1.5 patients. That was our average daily census for the pediatric unit. So removing those services and transitioning those to Fairview saved the hospital dollars.
Okay, last question. Sam O'Leary, Ward 2 Councilman.
Thank you, Mayor, and thank you, members of the panel, for being here tonight. I do have a question that's based on the Subsidium report, although it might best be answered by other members of the panel. And that question has to do with the chart that appears on page 80 that kind of tries to chart the various counter offers and offers that went back and forth between the clinic and Lakewood Hospital. Of particular interest, though, to me is in the final run-up, in terms of the transition payment, the Cleveland Clinic Foundation responded with an offer of $26 million. LHA countered with $26 million, and according to this, the transition payment in the letter of intent is 24.4. And the only other line item that changed is the payment for Columbia Road, which went from $5 million to 8.2, but I understand that that's largely in response to an appraisal that said that that was the fair market value for that land.
Yeah, that was a lively conversation and negotiation. Lisa, I don't know if you want to talk about that.
Yeah, you're absolutely right. We basically went back and forth in the negotiations, and for a long portion of the negotiations, we spent time looking at all the dollars as a whole. And so, you know, really splitting them into those various buckets was somewhat of an academic exercise. So, but ultimately, we believed that it was more important that because the 850 Columbia Road payment was going to go to the city versus going into this foundation, it had to be, you know, we had to be reconciled from that perspective. But that's where the difference came from. It was, you know, there was shifting of buckets essentially toward the end.
Thanks.
All right. So thank you very much for your patience, your questions. You gave us a lot to think about. Hopefully we gave you some things to think about in terms of the wheres and the whys. And we probably have plenty more to talk about. Looks like we have one more question. There will be another meeting on February 11th, Lakewood City Hall Auditorium. We'll figure out what the nuances of this conversation need to be more reflective of. I think what would be helpful if you could, in ways that are appropriate for you, let us know which areas you'd like to see more information. If it's the same crowd with the same presentation, that probably is a missed opportunity. I think if we could fine-tune it a little more effectively, it would be more helpful to you, and we need your feedback to do that. So if you take it upon yourself to share what you'd like to see at the next one, assuming you would, it would be helpful. Last question. Yes, sir.
Just a comment and a question. This seems to be more related to how healthcare is more for-profit than non-profit. And is the WVIZ tape going to be available on your website?
Cox Cable, you mean?
Cox.
Yes, it will be.
Okay.
Yes, it will be. All righty. Well, thank you very much for your patience. It was for... Well, we worked hard to get here, and we're anxious to tell the story. So thank you one and all, and thank you Beck Center for hosting us.